I'm Ridhima Bhatnagar, and I'm so thrilled to be taking you on this journey. Through the course of this evening, ladies and gentlemen, we aim to explore transformative ideas, advocate breakthrough innovations, but most importantly, celebrate the transformation in the healthcare space and ecosystem. You would all agree when I say this to you. Let's look at this picture. In a world where technology is rapidly changing, in a world where technology is revolutionizing every aspect of our lives, healthcare today stands at the forefront of this very vital change. Let's take a look at another picture. From preventive health to AI-driven diagnostics, the future of care today is being shaped by ideas that are bold, that are scalable, but most importantly, that are deeply impactful. Our partnership with Optum India, a global leader in health services and innovation, actually began with a very, very special initiative. That initiative was called HealthX Conversations. Let me tell you a little more about this initiative. It was actually designed to spark meaningful dialogue and inspire real-world solutions to a far more inclusive and forward-thinking healthcare ecosystem. And as part of this mammoth effort and partnership, we got together and we reached out to some of India's top educational institutions to ignite fresh ideas, but most importantly, to encourage young minds to think and innovate in the healthcare space. And really, ladies and gentlemen, building on that momentum, we collaborated once again for HealthX Elevate, an initiative that takes this mission forward by spotlighting startups that are turning ideas into impact, but most importantly, redefining how healthcare is accessed, delivered, and scaled across the country. Optum today, ladies and gentlemen, is helping really reshape the very foundation of healthcare by combining data, analytics, and technology to make care far more smarter, far more connected, and far more inclusive. With its strong presence in India, Optum continues to empower our healthcare ecosystem, inspiring startups to further push boundaries and elevate impact. And driving this transformative journey and this ecosystem really are the startups themselves who are at the heart of this very story. They're nimble, they're bold, and they're driven by a lot of purpose. They're evolving and rewriting some of the most complex challenges of our times and reimagining how healthcare really can be delivered and improving patient care, but also reaching to that last mile through innovation, because that really is the heart of the story. So ladies and gentlemen, today we all come together for one very crucial task, and that is exactly to celebrate that spirit of innovation, impact, and of ideas that truly elevate a lot of care. So let me talk to you what really has happened over the last few months. Over the last few months, we received a very overwhelming number of applications from healthcare startups across India. And after a very, very rigorous evaluation by an esteemed panel of jurors, we're proud to present the HealthX Elevate Startups batch of 2025, a cohort that truly embodies the future of Indian healthcare. That deserves a huge round of applause, ladies and gentlemen, because that really is the spirit that we, in fact, will be celebrating today. This year, as we said, we received a vibrant mix of entries ranging from diagnostics and early detection to AI companies and digital therapeutics, mental and emotional wellness, to physiotherapy and even integrated health ecosystem. And that really should tell you the kind of breadth and depth of innovation that we've seen that truly is shaping India's healthcare landscape. So let's really kickstart this evening, ladies and gentlemen, exactly with that spirit as we see the future of India's healthcare ecosystem. As of now, ladies and gentlemen, to give you an idea of what really has happened in the last few months, let's take a look at this very short AV to take you through the journey of HealthX Elevate. Can we play the AV, please?
India's healthcare landscape is pulsing with new energy. We are in the midst of a pivotal period, a transformative moment where a new wave of startups is leveraging AI and next-gen digital solutions to script a new reality. making healthcare more intelligent, accessible, and connected, unlocking a healthier future for 1.4 billion Indians. But groundbreaking ideas need more than brilliance to thrive. They need a catalyst, the right recognition, amplification, and the ecosystem to scale and transform lives. CNBC-TV18 HealthX Elevate, presented by Optum India, is a platform built around a singular mission: to find the boldest ventures and place them at the heart of India's innovation story. To find the best, we turn to some of the sharpest minds in this field, veteran leaders and seasoned entrepreneurs who have walked the talk. Now, meet the 10 who made it to the HealthX Elevate Startups batch of 2025. Breakthrough ventures with solutions that don't just promise change, they deliver it. This is the future of healthcare, and it's already taking shape. Optum India presents CNBC-TV18 HealthX Elevate, decoding tomorrow's healthcare today.
What a fantastic journey this really has been, ladies and gentlemen, and we cannot wait to show you what the startups have for each one of you that will really reshape, as I said, India's healthcare ecosystem. But to really kickstart the proceedings for this evening, ladies and gentlemen, we have a very power-packed panel that promises to have a very riveting conversation exploring how startups can scale innovation to create real change to healthcare delivery and access. And as I said, as the stage is being set, we cannot wait to show you the kind of work that these startups have done, and of course the work that they plan to do in the future to really scale up from where they are today. We of course want to start by welcoming our lovely moderator first. Join me in welcoming CNBC TV18's Ekta Batra, who in fact will be moderating this session for us. Ekta, good to have you with us. She in fact will be steering this entire conversation for us, which, as I said, is very, very aptly titled From Idea to Impact, Driving Scalable Innovation in Healthcare Solutions. With a huge round of applause, ladies and gentlemen, now join me in welcoming a very, very stellar panel. Join me in welcoming Vijay Barthana, partner, Global Optum Ventures. Let's have a huge round of applause as we welcome Vijay on stage. Sunil Thakur, partner, Quadria Capital and co-founder, Health Quad, is joining us on the panel. Prashant Warrior, co-founder and CEO at Cure.ai, is joining us. And completing this lovely panel, we have Gaurav Agarwal, co-founder and CTO at Tata 1MG. So good to have each one of you with us. Gentlemen, Ekta, the floor is all yours.
Thank you. Thank you so much, gentlemen. Please take a seat. All right, what a great way to start today's proceedings with such a power-packed panel. We have ideas coming in from different thought leaders within the pharmaceutical space and the healthcare space, rather. Just to give you a sense that, India right now is at a fascinating crossroads. We are home to some of the world's largest growing health tech ecosystems. We have multiple startups at this point in time with a digital health market which is projected to probably even reach over $20 billion by 2030. We have a deep pool of medical and engineering talent, yet challenges remain in the healthcare space in India, which is basically access and affordability. So this session really brings leaders who have shaped healthcare from different backgrounds, from investment to companies to thought leaders. And we're going to basically discuss what it really takes to move from a promising idea to a solution which really impacts and changes lives. Gentlemen, welcome to this discussion. Well, Sunil, I'm going to kick off the conversation with you. Today, we have a lot of startups which are here from the healthcare space. They want to basically understand what works while trying to make a change as well. So that's the first question. What is an investable idea, according to you, when it comes to healthcare? What do you think is, a promising seed, but which probably has scale and can probably get the profits as well? Sunil.
Thank you, Ekta, and thank you, CNBC and Optum, for having me as part of this panel. To answer your question, Ekta, and I'll look at it from a new age healthcare model because these are startups. because you can solve for healthcare needs by building hospitals and by building pharma companies and medical devices companies. When we talk about new age healthcare, what we as investors look for are models that are actually solving for must-have problems. And this could be different from Western market. You know, we're talking about India as part of our landscape. The idea and the model has to solve for must-have problems. Second, it should quickly come out with a real-world validation in terms of acceptability. The third aspect that we look at is that can it get integrated in the existing ecosystem of healthcare? And last is, can it be repeated across different settings, which is urban, tier 2, tier 3 cities, primary healthcare, community healthcare. Because in India, we're dealing with the challenge of access, affordability, and quality. And if you have to bring this iron triangle together, you have to scale it to a point where unit economics start to sort of contribute, at the profit level. So these four elements becomes very, very important. Solving must-have problems, real-world validation, needs to get integrated into the existing healthcare ecosystem, and can be repeatable and sustainable across different settings of healthcare. Okay.
Well, Sunil, just want to narrow down. In India, what are these must-have problems that one needs to address?
The must-have problems are huge, I would say. It spans across communicable and non-communicable disease. It spans across preventive healthcare to curative healthcare. And spans across solutions both for urban-centric population as well as for rural-centric population. So it's a wide gamut. I think, the challenge of India, which also creates the opportunity for healthcare entrepreneurs and investors, is one of very wide canvas, very difficult to pinpoint one specific area, which we believe is an area of challenge.
Okay, let me ask you, what's the flavor of the season then?
Well, from our perspective, the way we look at solving and simplifying it is preventive healthcare models. The healthier you keep the population, the better chances of them landing into hospitals or curative realm of medicine. And if they land, then what are the financing solution? If I have to look at it in a different. Now, when you look at the preventive itself is a wider gamut. You have medicine part of preventive healthcare, and you have the non-medicine part of preventive healthcare. In fact, the non-medicine part of preventive healthcare is a wider area. If you look at the social determinants of healthcare and the new age healthcare models, especially if I talk about technology, AI, all of it, to a large extent will start to solve for the social determinants of healthcare. How do you keep yourself healthy? How do you, have your ecosystem, your environment conducive to a better health? That itself is going to sort of, your behavioral nudges are not related to medicine or clinical attributes. They are related to your lifestyle. Sure. So that aspect, again, has a huge space. So it's, again, a wider gamut, but if I had to say in a very simple word, it is preventive and it is healthcare financing. It is, again, any model that can assist the clinicians to better deliver care. Any model that can create efficient enterprises, something that is selling well in a reimbursement world, which is the Western market. That again, is an area. So there are many layers to it.
Sure. Well, Prashant and Gaurav, you all are at the forefront of this, of preventive health at this point in time. And Prashant, I'm going to start with you. Your journey has been a lot about diagnostics, a lot about preventive health. So give us a sense in terms of the inflection points that you had when you had to scale up your business, and maybe the key challenges that you can share with all the healthcare startup founders here.
I think, we went through multiple stages, multiple inflection points, and I can talk through some of them as part of our journey, right? One of the first
your top three.
First inflection points was the reality that healthcare data is not easily available. And if you're training large AI models, you have to get access to data. And that was one of the advantages of starting in India, that we had access to a lot of data from hospitals. So we partnered with some of the largest hospital systems in the country, and we were able to build probably one of the largest imaging databases in the world. So which means that if you have more data in AI, you have better accuracy, better models. So that sort of helped us a lot, right? So figuring out that how do you partner with hospitals, how do you have the right commercial partnerships to get that data and to build AI on was one of the inflection points. A second inflection point, I would say, was also the regulatory aspect. I mean, when we sort of started commercializing, we thought our markets initially, we said we'll focus on the Western markets, US and UK specifically. And to sort of sell your products in those markets, especially in diagnostics, AI in diagnostics, everything is regulated, so you have to get through FDA clearance. And as an Indian company, we found it hard to figure out how to get those clearances. And it took us almost 3.5 years to figure out our first FDA clearance. Today we have 20, but it took us 3.5 years from 2016 to 2020 to get our first clearance. So that was something that, learning that, figuring out that sort of engine to get FDA clearances was something that was hard for us. And the third thing is also, in this journey, right, like I was saying, we thought we'll focus on the Western markets, but interestingly, one of the problems that we sort of solved was around detection of TB on a chest X-ray. And that is not a Western problem, that is not a US, UK problem, that's a very much a low and middle income country problem. And the problem that we solved there was that in 2016, WHO said that 2016 WHO said that X-rays are the first line of screening for TB. And they said, you screen with an X-ray, if the X-ray is positive, you do a microbiological sputum test. And that sort of started scaling up. But then what a lot of people realized is that there are not enough radiologists to read those X-rays. There are countries in Africa where there is 0 radiologists or 2 radiologists for the whole country. And you don't have enough people to read the X-rays. It takes 3 to 4 weeks to get those X-rays read. And that is where AI became relevant. And in 2021, WHO said that AI can interpret those X-rays autonomously. And that is still the largest autonomous use case of AI, where X-rays are taken, read by AI, and then if the AI says it's positive, it's followed up with a microbiological test. And just to say that the inflection point here was the go-to-market fit. Basically, we found that product market fit in TB screening, and it's one of 100 use cases that we solved for. We detect 35, we detected about 35, 40 findings on X-rays. We had so many findings on CTs, but this one finding actually became a very large product for us. And then, of course, from there, sort of we built on and built more products, both for the low and middle income countries, but also for the high-income countries. Okay, but your business is also a good example of the confluence of social impact as well as scalability in the business. So give us a sense, are you, making as much profit as you would like at this point, but at the same time, have you managed to scale up to allow yourself to reach as many people and to reach that ideal confluence of impact as well as profit in terms of business? I think the simple thing is, the ability to pay is different in LMICs versus high-income countries. So you have to realize that it's not going to be the same. If you get paid X in US, you might get paid 1/5 of X in Africa, for example, right? So you have to start with that assumption, but that doesn't mean that you cannot make profits. That your price point might be different, but the delivery of AI products is fairly high margin, right? So you can deliver at a lower price. You can have different products for different markets. You can basically offer up a lower spec product in the African market or in the Southeast Asian market. So we do multiple things, but honestly, it's a profitable business for us. It's not like the business in low and middle income countries is not profitable. Yeah.
Gaurav, I wanted to come to you now. Preventive health is something that we've already spoken about, but you have mentioned that it's very important for businesses to not get swayed and to focus on their core competencies as well. Not go for every shiny idea that they see. So is that what Tata 1mg has done throughout, stuck to their core competency? And even when maybe there is an attractive AI idea, you sort of rethink it because it probably doesn't fit in with your core. And would that be something that you recommend to a lot of these startups?
First of all, thank you for having me. And I think if you talk to our board, then they would completely disagree with you, and they would say that we've gone after every shiny idea we could lay our eyes on and hands on. But on a more serious note, I think we got very lucky that when 1MG started as a medicine content engine. And it was an accident, a serendipity, because unlike the West, India has branded generics. For every medicine that we have discovered, invented, we have hundreds of brands that get proliferated in the ecosystem through a variety of incentive schemes that get created. Unlike the West, we also don't have pharmacists who can educate a consumer about, what this medicine's about, how you're supposed to take it, what's the side effects, etc. And that was the core sort of wedge we identified, or not even identified. That was the core thought process that we had, that, hey, someone should educate consumers about this, because we thought education is one of the core pillars for better healthcare. That led to 1MG becoming, let's say, India's most visited health app, one of the most visited health apps in the world. And that started this consumer acquisition engine, then we could build the rest of 1MG on. And over the years, then what we have realized is that our ability, our core competence actually lies in, outpatient healthcare delivery to consumers in a way that's more accessible, more affordable than what anyone else can do. And all of our ecosystem, and the earlier question was about inflection point, but all of our ecosystem, all of our effort actually then revolves around how do we make sure this consumer content that we've created is not one time, because this is the mistake that most of our competitors make. They think that putting medicine content out there is a one-time effort, but it's not. We have a team today that actually is constantly thinking, refining, how to bring in more facets that actually give us better quality rankings, let's say, in search engines, better quality rankings in AI engines, etc., to bring more consumers in, and then constantly figure out how do we improve the quality of services, the scale of services, the affordability of services, to actually deliver really high quality care at really low prices. To give you an example, if you look at our diagnostic service, our efficiency of home diagnostics is 2x that of the nearest competitor, right? The ability it gives us to play at the scale that we can, it's unprecedented in the whole ecosystem, right? So to some extent, I think you're absolutely right that we've stuck to the core, which is actually quality, affordable healthcare, and we haven't gotten too, cute or crazy about it. But I think there's another responsibility as well, which is that once you have this engine going, what are new adjacencies that you can figure out that you can go invest in? And I think that's been a learning journey for us as well. We've gotten some of it right. For instance, corporate health and wellness, now retail, omnichannel, and there are some that we've just gotten wrong and we've had to shut down, etc. So I think it's a mix, but my recommendation is that until you get an engine going, stick to what you think is a core competency. As Prashant mentioned, try and get to a product market fit, right, which is that customers keep coming and you can continue to provide value to them before you go after the next shiny object.
Okay. Well, Vijay, you're seeing this from a global lens as well. You have a bird's eye view, really, of what's happening in terms of Indian health tech vis-a-vis what's happening in the globe as well. Where is India when it comes to innovation in terms of health technology and as well as AI, as compared to whatever you see, or how we could probably benchmark ourselves?
Yeah, no, thank you very much as well for inviting me here today. Great panel here, so very excited to be here and speak about this. And you're right, it is a privileged view that I sit in, and that's why I really love what I'm doing here at Optum Ventures from the global perspective, because over the last few years, just to set the context, we've been here for about 6.5 years now, seen the wave of innovation across the world, from Australia to Singapore to India to Europe to the US. And sometimes it's almost in sync. We're seeing that innovation happen, very similar innovation happen over time. And I would say over the last few years that everyone is sort of catching up. So at any one particular moment, we'll be looking at AI scribes. We were chatting about that earlier. We would see an Indian version, we would see an Australian version, we would see a US version. And what's very interesting about it, how everyone has almost caught up. So from a perspective of seeing what's out there, I think it's not about the newness of the innovation. Almost everyone is tackling the same problems now. It feels like the world is caught up generally. And specifically to your point about where India sits, I think it's right up there. And what I mean by that is something that really came to mind when I was thinking about this panel and speaking to these gentlemen earlier, was that the Western markets have been building with a lot of challenges facing them, a lot of deeply ingrained healthcare IT infrastructure companies that have made it harder to scale and harder to innovate and get to patients and reiterate and learn from those. And you've had that freedom here where you haven't had that burden or legacy, which means that you've been able to innovate very quickly using modern platforms, a more consumer-centered, very patient-centric design. And so a lot of the companies I'm seeing nowadays from an investment perspective have sort of leapfrogged a lot of the technologies and are designing solutions that are way more innovative in certain aspects. Now, there's a lot of challenge with everything that I've just said. It doesn't mean that it's easier to scale or commercialize or go international, but from an AI talent perspective, it's right up there.
What do you think is probably the biggest challenge that India faces when it comes to health tech AI?
Depending on which way you want to answer that question, I think maybe from the scaling perspective and internationalization. I sit in London and I look at opportunities, and part of our investment thesis that we're looking at to back companies that want to scale outside of their home country, be that from Europe into the US or from India into the US. And so we're very hyper-focused on those opportunities where they're looking at a global expansion story. And the challenge there is that we spoke about regulatory and all those different requirements. We've had some very expensive mistakes in some earlier portfolio companies where we've gone too early. We haven't had the understanding of what the regulatory requirements are from the US or wherever it may be. And I think with all those lessons now, I think if I think about new companies that we're investing in or talking to, with all those lessons, it's about really identifying what the plan is. So if you're India only, for example, or you do want to scale into the US market, there are so many challenges you need to start considering about regulatory, about reimbursement. And I think one of the most important things that people don't realize that we've started to become really smart about is how does it integrate into workflow? Because not every solution actually fits in every single healthcare market. And the people using it may not necessarily be the people deploying it in other markets. And so it's really interesting. I've really enjoyed going through that with new companies, but I think part of the challenge for companies everywhere is trying to understand that.
Okay. Well, the theme seems to be that you need to localize yourself also to a large extent when it comes to India. So in that sense, you can cut across India in two ways, either geographically or go deeper into the country as well. So Sunil, you look at multiple proposals a day. So give us a sense, what's more attractive? Going deeper, looking into tier 1, tier 2, going into the rural part of India and really sort of scaling up there? Or do you look at an underpenetrated geography, say, for example, the eastern part of India, where, in fact, a lot of hospitals and diagnostic companies are looking at it much more aggressively? What is the way to go for a health tech?
We have a very strong impact thesis as part of our investment strategy across both the funds that we invest from, which is Quadria and Health Quad. So in an ideal world, if we were a single LP fund, like my co-panelist, without any tenor to return the money, there won't be pressure on friends like Prashant. And in that case, I would have ideally solved for solutions that are more oriented around tier 2, tier 3 cities. The challenge for a fund like ours is that it has a finite life. So I also need to see the commercial viability while addressing impact. So the larger need is in the tier 2, tier 3, the extra urban rural centers. But for technology to succeed, you need to have the ecosystem supporting the technology. So, any simple technology also need an assisted support system. Like in a rural setting, say, Abha workers, or, because you cannot directly get technology to the end consumer. So that particular ecosystem is lacking in India so far. So in an ideal world, I would want to address the larger population problems, the 60-70%, but because of our structure, it becomes challenging. So for us, the attractive models are more around enterprise models, because there is a bigger incentive, shorter sales cycle, and there is a larger imperative to become more efficient, become more patient-centric. And those kind of enterprise largely solve for urban-centric population set. So that is one. If I look at a B2C model, that again largely falls under the urban-centric, where the awareness is very high. People seek more convenience, and larger, health tech models are solving for those, and the propensity to pay the frequency and the per capita consumption is much, much higher. So it adds to all those levers that can make any venture scalable and profitable much quicker in the lifespan of our investment.
Gaurav, you're a big advocate of tier 2, tier 3 and going deeper into the Indian market. Give us a sense in terms of how, impactful, yes it is, but how does it do in terms of the P&L?
Yeah, so, I'm not sure, but at one point, Bill and Melinda Gates Foundation was actually an investor in 1mg. And we've had multiple investors invest in 1mg over the years. Because access, as you said, is one of the biggest challenges to solve in tier 3, tier 4. So the first time one of these impact investors came, they asked, are you a metro-only company or do you do tier 3, tier 4 as well? And frankly, we had a sense, but we didn't know the numbers ourselves. So for the first time, this is many, many years back, we looked at the numbers. And we found out that 1/3 of our business even then, and it's much larger today, was actually tier 3, tier 4. These are cities that you would not have heard of. And they were growing at a much faster clip than the rest of the country. And they were more profitable than the rest of the country. And we're like, what gives? And the fundamental insight there was that in tier 3, tier 4, there's a core access to healthcare challenge. So most tier 3, tier 4 residents actually come to, let's say, a tier 2 or tier 1 center. They get treated, but then they have to go back. And the moment they go back, they actually don't find the medications that their doctors prescribe. Right? There's no ecosystem, there's no supply chain there. And 1mg was fitting very nicely in that need. So, I feel there's a real need in tier 3, tier 4. For us, that's a core area of focus. Even if you look at our diagnostics, we are in 65 plus cities. Only 4 or 5 of them are metros. The rest are increasingly now starting to be tier 3, tier 4. Pharma, of course, 40% of our business is tier 3, tier 4 and increasing at a clip. I think the core idea again there is that what is the benefit that you provide? And I honestly think that in the day of AI, etc., we tend to get carried away that tier 3, tier 4 requires AI, but their needs are probably much more simpler and much more, just quality healthcare to be made available. Yeah.
Well, Prashant, I'm going to get you in on this because Gaurav mentioned 2 interesting words, which is basically tier 2, tier 3 and AI. And you have IRA, which is basically an AI format of reaching out to a specialist if in case you can't in tier 2 cities or where they're not available. Just give us a sense. It's just been 3 months since you started it. But what is the feedback and how scalable is that? Are you thinking of other ideas from it?
So, so what IRA is a product that we launched about 3 months back. What it does is it can imagine a doctor-patient conversation. That doctor-patient conversation, the notes from that conversation there is an ambient listening tool that is, device that is sitting, could be a phone, could be a tablet. But it is just listening to that conversation. It is summarizing that conversation and inserting all of that into an electronic health record, right? That is the first use case. That is the basic use case that a lot of these conversations, especially in India and low and middle income countries, are not being digitized. Patient records are not available digitally. So just being able to digitize those conversations is a big value proposition. And that is something that we're doing now across multiple hospital systems, both in India and some parts of Africa. The second value proposition there, which we are starting to sort of build out, is a lot of these conversations are also not necessarily doctors who are doing that. It's also nurses, healthcare workers who are having those patient conversations. So in that, you can upskill them. You can give them some guidance on what kind of tests should be recommended, what kind of diagnosis the patient might have. You could, basically, we identified there are 3 things that you're looking for. One is that you have to collect symptoms accurately, right? So even being able to tell the healthcare worker that you should ask for this particular symptom. If you have a headache, you should ask for fever, right? So that AI can sort of prompt them on what kind of questions they should ask. Second is what kind of tests you should do. In a primary care setting, what tests do you do, right? And third is what diagnosis you have. So if you solve these 3 problems, you can actually sort of become an AI doctor, right? And it's a long-term vision. I think it's not going to happen overnight, but idea is for IRA to become that AI doctor where it supports that physician or frontline healthcare worker in conversing with that patient and being able to collect the right information, also prescribe the right tests and treatment.
I hope the doctor, is able to diagnose the patient without AI after a point as well. But Vijay, your sense in terms of AI and where India is, because AI is supposed to be localized, to the Indian needs. But where is India in terms of the AI race?
I think, to my point earlier, I think it's right up there in terms of the AI race. If I look at the opportunities that we've been reviewing, and just to be clarified.
Give us an example in terms of what the opportunities you could be exploring in India when it comes to AI.
Yeah, absolutely. And I think AI scribes and what we're discussing over here and AI co-pilots, it's such a hot topic right now. So we're seeing opportunities on a global perspective of doing exactly what was just been described, which is ambient, listening in the background, transcribing that, pulling out the key highlights of that transaction, and then inserting into like an electronic record. The interesting parts about that is a lot of companies are being able to do that. A lot of companies are doing exactly the same thing. What's really interesting, the ones who are going to win are probably the ones who can take that and trigger the next best action. And we're seeing a lot of companies do that in India as well, or apply it to radiology platforms, or apply it to primary care diagnostic platforms. So there are specific examples. I can't name the names of these exact companies here, but they are doing it. And so applying these technologies in such a way that it's not such a deep vertical that you've solved one piece of the puzzle and then you've left the doctor or the physician to continue doing labor-intensive tasks, but the overall gain is quite marginal, but what you're doing is solving the entire clinical pathway, both from the transcription of the interaction, suggesting what's next to do in the diagnosis, writing a referral letter, for example, and then prompting to book an appointment to come back later. That kind of end-to-end is what we're seeing a lot of. And I think what's interesting about the companies I've seen here versus the companies on the West, for example, is that in order to achieve that, there's a level of integration, a level of security, a level of complexity that's required that doesn't exist here. And so you're able to be more innovative here and get those solutions up and running faster here.
Okay, Sunil, go ahead.
So and just to extend what he mentioned, see, we always look at AI, and most of the conversation is around the healthcare services, but there's huge amount of usage of AI in clinical trials and drug discovery in India itself. Because, India has a lot of these GCC, Global Capability Centers. In fact, most of the big pharmas are now, creating large centers here. There's a huge amount of usage of AI there. But beyond that, as he mentioned, clinical augmentation. You may not have products, but today we know doctors are using ChatGPT, which means that they have now tuned themselves to using AI to augment their own clinical capability. Diagnostic is the other big area where, AI is going to sort of grow in terms of use.
Well, we have a few minutes left, so I'm just going to quickly toss this over to you, Sunil. One of the statistics is that 27% of startups also don't go beyond Series A funding. They just don't manage to cross the line. Why is there, what's going probably wrong after that for companies to scale up or not get to the other side of being profitable?
A lot of focus on innovation and lesser focus on seeing the real world challenges in India. I think that to me is a starting point. So at times, and I've seen, quite a few of these budding scientists and innovators, especially in the engineering colleges, where you have accelerators. They're so close to the entire scientific innovation that they just forget the real world problem. So again, I come back to the original point. Are you solving the must-have problems? Do you have a clear visibility while building the product about the execution pathway? And how are you going to integrate yourself into the broader ecosystem? That becomes very, very important. And most entrepreneurs who we've seen failing are missing either of these three things. And I'm not talking about the sustainability and the repeatability, because only when you get the first three right is you get to a repeatable and a sustainable model.
Prashant, what do you think?
Absolutely agree with Sunil. Absolutely. I was going to say the same thing, that I think we build a lot of tech, and especially in healthcare and in B2B healthcare, when you're selling to hospitals, understanding the clinician very well, understanding the workflows very well, integrating with those workflows, that is super critical. I mean, a lot of times there is very good tech, but if you don't make it easy for people to use, and it's not about just ease of from a design perspective, making it easy, right? You have to figure out how sort of patients flow through the system. You have to understand the health system really well. And a lot of times techies like me, I'm also techie myself, right? We don't spend that time understanding the healthcare business really well, how hospitals function. And it is different across different geographies. And in India also, you asked about the split. I think there is a difference between private and public sector. So if you're building for the private sector, there's a certain workflow. The building for the public sector is going to be different, right? So you have to understand how that flows, and the flows are different for oncology patients, maybe versus orthopedic patients. So what you're solving for, you need to understand that domain, that particular problem in a lot of detail. And if you're able to solve for that and build the right workflows, I think you can be successful.
No, I'll just
going
add,
from the pilot phase and then not being able to get to...
I'll just add the consumer lens here, because a lot of what we've talked about is the clinical enterprise lens. But, you know, I feel in consumer, most often the mistake that I've seen made is that we often confuse scale with product market fit. You know, you can get scale, and I can see Sunil like shaking his head, because I've seen a lot of people just do marketing, get scale, and then confuse that there's a product market fit here. That doesn't mean product market fit. Product market fit fundamentally means that, you know, there is a need, even if you didn't do marketing, for your services to be needed by people, for them to keep coming back. I've seen most founders actually forget the simple fact that, are they, you know, even if you have product market fit, can you do it sustainably? I've seen, you know, so many companies that came about trying to cure diabetes or other healthcare services, you know, paying CACs of 30,000 rupees per consumer and then making maybe 8,000 rupees per consumer as a residual before they churned out. So I feel, you know, first and foremost, just like an enterprise, you have to understand what's the core service that you're providing. Is it sustainable? Are consumers repeating on their own? Scale is not, you know, a need for your services. Product market fit, it's basically just a crutch. And then look at fundamental retention metrics, etc., for what you're offering. You know, that's what something in a consumer business at least needs to do.
Vijay, how does an investor sort of handhold beyond the funding?
Yeah, I just want to add on a point to that. It's why companies struggle after that period, and I'll come to that point as well. I think we should talk about pilots as well. So we have a lot of companies that invest are around that stage of where they're thinking about doing pilots. And there's a new term that I think it's out there, called pilotitis, where, you know, we're getting an aversion to companies just doing lots and lots of pilots and not getting anywhere, and they think it's a success metric. And I think part of the issue that companies struggle, and we've really spent a lot of time with this, and that's part of the hand-holding, is, okay, you're doing a pilot because you want to prove that there's value here. So a well-designed pilot with really identifiable key success metrics. If I achieve this, what does it mean for you? What does it mean for your business? And what does it mean enough that you will go into a commercial contract with me, and therefore we can start going? I think part of the issue we've seen, and one of the things we've noticed most recently, is people are doing pilots with really innovative institutions because by nature they're innovative, but they're quite bespoke and quite niche. They don't represent the larger group. And so you finish a pilot and you realize this is just a case study and it doesn't actually translate to other groups. And so, you know, part of the education, the hand-holding we do is, okay, when you're designing a pilot and you're choosing institutions to pilot with, how much do they represent the majority? So that when you do achieve the success metrics, you can scale. You can say, look at this case study. This is the ROI. That's applicable to you. And so sometimes you can get caught in those traps as well. So apart from things like that, in terms of hand-holding, we think about our role in a few ways. One is scaling. So we're integrated and understand a lot of healthcare systems in the UK, US, and Europe. And so when we're evaluating opportunities and making the investment, we're also thinking about how do we make sure their business model applies. So we do a lot of adaptation to their go-to-market model. We do hand-holding and introductions to healthcare systems. And we also tell them, you know, maybe it's not the right time. Maybe you're not ready for this and what you need to do. And I guess part of our also, what we do is trying to strategize around their cash, the runway, milestones, projections, trying to understand, okay, you need to achieve this in order, because typically venture-backed companies, there's another fundraising to come around to what you need to achieve before you can think about scaling. So hopefully both of us investors here, there's a lot of hand-holding, more than just the check.
Okay, just a few minutes. So Sunil, you know, for a health tech startup, how important is it to be profitable? Would you want to look at the company which is profitable and, you know, is maybe hitting a core competency, or maybe a company which is trying to innovate but is burning through cash?
So again, profitability at some point becomes very, very important. So while on our, growth capital fund, which is Quadria, profitability is must have because these are again stable cash flow generating businesses. But when we talk about a venture growth health quad, profitability is not must. But what is very, very important is the understanding of the market by the entrepreneur, the unit economics, because at some stage it has to generate profit. So if it's on that track of having the right unit economics and is riding the rail of what we call as the unit economics of access, then that at some stage will deliver profit because every incremental customer or patient will add to your bottom line. So one needs to get the unit economics right and obviously an understanding of the market because that is what is going to deliver the access and obviously the volume to lead to profit.
Okay, well, I've been told that we've completely run out of time, so just a quick last round of brief answers from you all gentlemen. Gaurav, I'm going to start with you. If you have to give one brief piece of advice to all of the startup companies here, what would it be?
Oh man, that's a tough brief question. I think India requires physical and digital to come together. It's probably unique in that sense. We are big believers in it, so think of how you can serve customers both physically and digitally.
Yeah, so you need to be phygital. You can't just be digital, or you can't only have physical presence.
I don't think you need to be, but I think India supports phygital model more than it supports digital-only models today.
Okay. All right. Prashant, your advice.
I already said this in the last question. You have to understand the domain really well. To talk to a data scientist, they'll be able to read X-rays better than most radiologists, and they have spent so much time reading X-rays, right? So you have to understand the domain really, really well, and that is how you'll solve a healthcare problem.
All right. Vijay?
I'm going to steal yours and say unit economics, just really deep understanding on the unit economics of a business model. That has to be the core.
And Sunil?
That was my thing, but since Vijay...
I'll ask you a question.
Vijay,
Are you looking, what kind of returns are you looking for from these health tech startups? And what is the time frame?
We always go for multi-baggers and unicorns. So let me give you that answer. But, coming back to the previous one, generally what we try and tell them beyond unit economics is the real market is beyond your lab. Because most of the startups that we come across are in an urban setting, are in the best of the institutions. They forget that the real market is beyond the city that we are living in, that we are incubating our companies in. So they need to go to that market. So that's the punchline.
But the average return, I'm just going to circle back, over what kind of time frame? Just give us a number.
So typically, like any venture fund, we typically look at 35-40%.
All right, and time frame? 5, 10 years, 3 years?
When you have IRR, it could be 5-10 years. The multiplier is on cash. So the more you hold that 40%, and since I'm sure most of you are engineers, you know the maths.
All right.
So we look at 5 to 7 years is the time frame that we
All right, 3 to 4 times over 5 to 7 years. That's what investors are looking for when it comes to health tech startup investments. Thank you, gentlemen, for joining in and giving us your deep insights in this space. Thanks very much.
Thank you.
Thank you.
I think we can have a louder round of applause. Thank you, Ekta. Thank you to the lovely gentlemen. We get them together for a lovely picture. That, in a way, has really set tone and context of what we plan to achieve and also give us an idea of where we stand, but most importantly, where we are headed as well. So, ladies and gentlemen, when we started that evening, that one question that was asked to us that, yes, you're talking about all these promising startups, but what really was that rigorous process? What really happened behind the scenes? Talk to us a little about that. So that's exactly what we're going to do now so that we can give you an overview and an insight, as many would say, of what really happened behind the scenes. How did we really come to shortlisting these startups and what you can in fact see for the rest of the evening as well. Of course, the big stars of the evening will be our innovators. But before we meet the HealthX Elevate Startups batch of 2025, I do want to take this opportunity now to invite someone very, very very special on stage, who, as I said, will give us a little backdrop inside the kind of work that has gone on in getting these startups together. So with a huge round of applause, ladies and gentlemen, join me in welcoming Shishir Kumar, the Senior Director and Global Capability Lead, Healthcare from Optum Advisory, to really take us through that evaluation framework. Shishir, so good to have you with us. Good to have you with us. The floor is all yours.
Do we have the... Good evening, ladies and gentlemen. What an amazing panel discussion we had, from AI to diagnostics to unit economics, financials, the getting spoiled for the term, and of course, like scaling from tier 1 cities to tier 4 cities. And with that, in this August gathering, I'd like to begin with a very, very famous quote. Change is crucial. It begins new thought. New thought leads to innovative actions. This quote is by Dr. APJ Abdul Kalam, who captured, and that quote, that's very special because I was with him and I've been living with him, I've lived with him for a while. And this actually captures the spirit of HealthX Elevate, an initiative to recognize the innovation that's shaping the future of healthcare by offering strategic visibility, expert insights, and access to a powerful healthcare ecosystem for the high potential startups. Good evening, everybody. I'm Shishir, and I lead the Optum Advisory, and Optum Advisory is a knowledge partner for this initiative. And it's my privilege to be here amongst the leaders who are not just witnessing change, but are driving it. As knowledge partners, we were entrusted with designing a rigorous, robust, and fair evaluation process. This demanded more than enthusiasm and intent. It called for a structure, perspective, and a deep understanding of what healthcare landscape of tomorrow needs. Our goal wasn't just to find promising startups, it was to identify those with potential to drive measurable outcomes and respond to the evolving needs of the healthcare ecosystem. The HealthX Elevate actually was anchored in 6 themes, which you can see here. It spanned the entire healthcare continuum. Each theme addresses a critical gap, brings together a forward-looking view of how healthcare can be smarter, faster, and more equitable. To do justice to these themes, we needed an evaluation approach that could match their depth and ambition. That's where our framework came in, balancing innovation with feasibility and drawing from our consulting experience. It was tailored very, very uniquely to the unique demands of this program and built to reflect the realities of the healthcare transformation. We designed a layered evaluation approach that brought clarity and consistency to every stage of the process. With each stage, the analysis grew sharper and more precise, enabling deeper insights and confident judgment. This progression helped us to build a well-rounded view of each startup's potential, ensuring that every decision was made with an intent and reflected the clear integrity and spirit of the program. The multi-layer process wasn't just about selecting the winners, it was about building trust that the startups we spotlight are not only innovative, but are ready to deliver the scale aligned to the transformational priorities and the program. Our level 1 screening filtered hundreds of applications, startups. It assessed the industry alignment, relevance to the transformation themes, technological maturity, and future readiness. We also introduced an outlier process to ensure that unconventional but high potential ideas that narrowly missed the baseline weren't lost, which is what we discussed in the panel. So we just don't look at just the unicorns, but also the key early investors. So with that, I think the level 2 focus that we had was on fundamentals like idea and solution relevance, market potential, execution capability and maturity, team strength, financials, health and sustainability. Lastly, the regulatory and compliance. Through the demos, we gained further insight into each startup's execution, maturity, real-world applicability, and growth potential. The final leg of the journey was the jury round, for which we developed a hexaquad scoring model, a 24-point lens built on 4 sub-criteria across 6 critical dimensions, which you can see here. It's very, very comprehensive. It captured the complete spectrum of what it takes to succeed in a healthcare innovation setting. The evaluation built on the foundation laid earlier to highlight the most compelling opportunities. The jury comprised of healthcare stalwarts, leaders from across the country who brought in deep domain insight and practical perspective to the table. Their deliberations helped to surface the top 10 startups we are spotlighting today. Through this journey, each startup brought something very valuable, and many of them have made a strong impression. But these 10 stood out. They didn't just bring up promising solutions, they have thought clarity, confident approach, and are ready to take it forward. These startups span diverse focus areas from early detection to health and well-being to last-mile care delivery, but they converge on two common fronts. One, a commitment to transform healthcare and make it better, more accessible and effective. The second is they all resonate with the core 6 themes here that HealthX Elevate set out to champion. So without a further ado, I'd like to hand it over to them to share the vision, their journey, and what's next. Let's discover the future of healthcare together. Thank you.
Shishir, thank you so much for that. I think we can have a huge round of applause because it was very important before we really meet the stars of the evening to try and understand this very rigorous evaluation framework and process. But without keeping you waiting for any longer, ladies and gentlemen, this really is that big moment that we've all been waiting for. It's now time to really shift the well-deserved spotlight on our first group of innovators this evening as part of HealthX Elevate Startups batch of 2025. Now, these are the startups whose groundbreaking innovation really have the potential to disrupt India's health tech landscape, making care smarter, faster, and far more accessible. But before I call on the first startup, I would really like to remind that the founders have only about 5 minutes to make their presentation. And after that, we open the floor for a Q&A. I would also like to request the audience to participate very, very enthusiastically. And this is an opportunity that I don't think we get very, very often. So I'll repeat the law of the land, as they say, 5 minutes to make your presentation, and then we open the floor for Q&A. This is the same process that we will follow for all our startups that have a presentation on stage. So ladies and gentlemen, without any further ado, are we all set before we call on our first startup? Okay, I see some nods. That's good to see. Ladies and gentlemen, join me in welcoming our first startup of this evening, Briota Technologies Private Limited, and join me in welcoming Aditi Roshan, the co-founder and CEO, along with Vaibhavi Dattaraj, the business analyst, who in fact will be presenting on stage.
Hello, good evening everybody. I am Aditi and she's Vaibhavi. We are from Briota Technologies. Briota Technologies is on a mission to screen 100 million people for NCDs by 2030. Our journey is nothing but a impact, but which started with an inspiration. Our founder, Dr. Gajanan Sakhre, saw his mother suffering by asthma and not able to do day-to-day chores, and that is why he decided to build India's first AI-powered digital spirometer, Spiro Pro. We started in 2018, but in 2020, we launched our innovation, Spiro Pro, in the market, which attracted an award, which is OP's most innovative medtech support award in 2021. 22-23, we launched ourselves in Nasik, where we did screening in almost 46 villages. When the journey went ahead, we established ourselves and we expanded ourselves in SAVE platform, which is an AI-first POCT platform, which is called Suraksha. 2024-2025, we are going ahead by screening 14 NCDs, and we have launched our smart clinics in Tier 2, Tier 3 cities. Right now, we have 22 smart clinics in Tier 2 cities. We will be going ahead with 100, and because of which we have attracted with the Series A funding from Philips and Sanofi. You all know non-communicable diseases. The problem is very, very grave. Premature mortality is eating up India's healthcare ecosystem. What we have a solution called Suraksha, a POCT platform, which has a POCT care devices backpack, which Vaibhavi can show you. Or with that, we have a mobile app, AI-enabled gold CDSs, Indian demographic ML models, teleconsultation. What is a backpack? A backpack is amalgam of the 14 POCT devices, which are mostly non-invasive, integrated with the AI platform. 4 of them are manufactured in our facility in Pune. You can see a bigger picture here. These are the various devices which we just spoke about. The basic and important factor of any NCD is patient journey. Here, our patient journey starts by patient visiting a PHC or a nurse going home and doing the testing at home. With that, we have an app which is in a vernacular language as well. With that, we get a particular health score in your app. With that, we can go ahead and do the POCT screening, and we have a doctor's intervention which can identify or diagnose the patient. Right now, we are integrated with ABDM and other project-related platforms. Yes, we are made in India, regulatory approved, patented, and we were very fortunate to receive many awards from 2008. Our existing customers include government, insurance, GP, and hospitals. Market offering. Market offering is a Suraksha as a test, is a diagnostic test which is paid by the customer to us. And when they go to any hospital or any PHC, with our AI platform Suraksha and with our POCT, there is a diagnostic test which takes place and the journey starts for the further intervention. Second market offering is Suraksha Smart Clinic. Biota Suraksha Smart Clinic is reinventing rural, urban, primary healthcare with predictive diagnostics and connected care. We are looking forward for 100 operational clinics by 25-26. These clinics are based on our original and proprietary AI-based Suraksha platform, which gets integrated with the further facilities. We are proud, we are Make in India, made for Bharat and ready for the world. We are already working in 9+ states in India, going abroad, going beyond the state and going beyond the country, and we'll be expanding ourselves in many of the countries stated. Healthcare services has been always a constant, and we are trying to work towards it, and we are there in all across pan-India. Suraksha, you can see in the pictures, we have actually reached to the level or tier 3, tier 4 and the reserved places where generally healthcare is never a facility available. These are the few projects we are talking about. A very motivated founders team. We are working for last 15 years together, not only with Bryota, but with our previous avenues as well. We are very lucky to have advisors across globe. And also, we are proudly associated and incubated with IIIT Delhi, iHub Anubhuti, and AICCC MB in Hyderabad. This is us, Bryota Technologies, bringing the innovation at your doorstep, making sure that NCDs are not the problem, but NCDs can be cured at the right time. Thank you very much.
Hi, good evening, everyone. This is Shruti Mishra, editor, Startups and New Economy at CNBC-TV18. Team Bryota, thank you so much for your pitch. Request all of you investors and founders, if you have any questions, I see a hand there.
Yes, sir.
Can we give him a mic, please?
Rajiv Gupta. Hello.
Yes, audible.
From campus in Chennai. What is your team size?
Sorry?
Team size.
So we have two type of team. One is the one who works with tech and the day-to-day. So there are around 35. And then we have project-based. So right now we are running a team of 82 people, sir.
And you manufacture all of it yourself? Or?
So 4 devices are proprietary, which are CDSCO certified. And we have a HTA with ICMR for respiratory, and they are all manufactured in Pune.
And how big is the manufacturing facility?
Sir, big in the sense we are CDS certified. We have an office. We do some in the office. Some are outsourced. Some parts are outsourced.
What do you need the funds for?
Sir, we need funds for scaling. We are putting up 100 smart clinics. These smart clinics are going to the niche area where a diagnostic tests are not available, sir. There is a BHMS, BMS doctor available who can do a primary investigation. But when you need to do a ECG or when you need to identify this person has any kidney issue, we have these non-invasive devices which can give you the first line of identification which that person needs to go further or not.
In the unit, the smart clinic would require experts and what investment?
Sir, the devices are very easy to use. Right now, ASHA workers are using in our project because the app which is integrated with the devices, the whole platform, is made in vernacular languages, sir. So they are very easy to use. Prompt has been given how to use the app. There is a CBAC survey which takes place. So there is a family history which gets connected and on what the AI/ML algorithms gives an assessment or a health score. So that is why right now when we are working with ASHA workers. So for scaling, we can definitely go ahead.
And what will be the cost to the patient?
Sir, cost of the patient depends on where the screening is happening. So for example, if it is happening in a smart clinic, which is an established healthcare center, then it will depend every test. So it is a very, very lesser cost, which I would like to send you separately if you ask me. But it is not what some other diagnostic lab will be asking for.
Sure, we'll need more details on this.
Your cost per screening you cannot tell us.
Sir, it depends on how many screenings you are doing. So there are 14 NCDs. We cannot talk about only one NCD right now. Generally, the first is a profile making in which sugar, BP, anemia are the basic tests which happens in around 50 to 60 rupees, sir. Not more than that.
All right, any other questions? We can take one more. Yes, go ahead.
Gaurav, this side. Who are you selling this to and what is the revenue model?
Right. Very good question. So this is generally, we ask for. We have insurance companies working with us which are giving a next step for their, deployment. So insurance company wants to do testing in the clinics. So people who are insured, generally insurance people want to know how much money is involved while insuring somebody. So we have an insurance as our B2B, sector where we are getting the project. We have government with whom we are working, and then we have the smart clinics where we work in 3 model: a company owned, company run, franchisee model, or a direct franchisee owned and franchisee operated model.
So who buys the device right now?
Sir, it is a system. So it starts with a POCT screening till the teleconsultation. So it's an end-to-end system which has been provided. So devices separately we are not selling. We are on GEM with a full backpack.
Okay. So let's discuss later.
Yeah.
All right, we'll just take one quick question and then we'll move on to the next startup.
You talk about the diagnostic part of it, but
Right.
what about the therapeutics? I mean, are you also looking in to have a more comprehensive, like after this POCT devices,
Yes,
looking at the
definitely.
continuum of care?
Right, very true. See, what will I do? Only screening people, right? After screening, there has to be some steps which has to be taken care. So we have an end-to-end solution which includes wellness, which includes a teleconsultation with the doctor, which includes after diagnosis, follow-ups. So there are many steps which takes place once the POCT screening is done. So we do take care of the patient's journey end-to-end, basically.
All right, with that it's a wrap. Thank you so much, Aditi. Congratulations, Team Ryota. Wish you the very best.
Thank you, Team Ryota. Thank you so much. Thank you, Shruti. We'll, of course, need you after our next startup as well. But the journey really has just started. The evening has just started for us, ladies and gentlemen. There is so much inspiration around us. There's so many promises around us. And that really gives us so much optimism when we think about the future of India's health ecosystem. But ladies and gentlemen, it's now time for us to call upon our next startup. With a huge round of applause, ladies and gentlemen, our next startup is No Worry, No Tension Healthcare Private Limited, and representing the company is Dr. Sandeep Vora, founder, chairman, and MD. Let's have a huge round of applause as we welcome him on stage. The floor is all yours.
Good evening, everybody. Thank you for coming and encouraging us. I'm Dr. Sandeep Vora, and I'm founder, chairman of No Worry, No Tension Healthcare, which is an emotional and wellness platform which covers everything from prevention to cure. The team consists of psychiatrists, psychologists, technologists, and data scientists. And the partners, we have Hitachi MGRM, University of California, San Diego, Apollo HealthNet Global, Mental Health International Collaborative, a group of 26 countries, MET, and Manav Rachna. For easy understanding, I've just loaded 2 videos for you.
Are you stressed? Do you feel anxious? What if you could measure your stress and emotional wellness level at home, just like you measure your blood pressure? This is now possible with a single tap of your phone. Introducing Emotional Wellness Index. This is a 10-minute test with a few questions. Once you answer all the questions, you will be shown your emotional wellness level using a color band. You can also see how different factors in your life affect your emotional health. These include your nature, your circumstances, your body and mind, your domestic life, and your professional life. Interpreting these color levels is also very easy. Green color would mean that you are normal and healthy. Blue color would mean that you are going into stress zone and must talk to someone to unload yourself. Yellow color would signify that you should take the help of a counselor. Orange color means that you need a psychiatrist's help. Red color would mean that you need urgent help of a psychiatrist. What's more, this test is scientifically validated. So try our Emotional Wellness Index now to check your emotional wellness, and see if you need any help.
Let's see our vision to scale is as under. This is the second video.
Dr. Sandeep Vora's solutions for emotional and mental wellness cover all professions and industries. These include corporates, government and private hospitals, educational institutes, security forces, communities, governments, or any other organization. Our services include online counseling and/or drug treatment, offline counseling and/or drug treatment, online and offline emotional wellness index with a separate version for students. You could choose one of these services, or a combination of two of these services, or all three services depending on your organization's requirement. We will continue to grow by adding more mental health professionals from all parts of the world to our platform. As more evaluations are made, we will continuously analyze them to improve the software. Augmented human intelligence will make sure our products are as effective as possible. These are the 21st century solutions for the emotional and mental well-being of the world, and will ensure a happier planet.
So what is our pan-India plan for implementation? Our beneficiaries are educational institutes. We have specifically for students by the name of Student Emotional Wellness Index. Besides this, we have for corporates, hospitals, security forces, any organization, any diagnostic chain, insurance, and community at large. We have Adult Emotional Wellness Index. We are planning to tie up with Government of India through CSR initiatives, NGOs, philanthropic organization, voluntary organization, as public-private partnership. And we plan to complement our services with 1.76 lakh Ayushman Arogya Mandis and Telemanas. Basic aim is it becomes very easy to train the ASHA workers or Anganwadi and community health workers, because this emotional wellness index concept is a color-coded analysis. It leads to automatic triaging of the person, helping the person who's seeing them, for example, ASHA worker, to automatically refer them to a higher institute. Besides that, it's a big help in policy planning, because with this we can have group analytics emotional wellness index, which assess the degree of emotional health problems, it can cover all the 800 districts of India, generating heat maps, and that actually will happen at 10 times better speed and at least 1/10 of the cost. And we can actually, government can actually plan budget as well as human resources allocation in the field of mental health in a most economical manner. Ways of implementation, what we are doing it either through API integration or link-based or QR-based analysis. Of course, simultaneously we are making it DPDP Act compliant, and we are seeing to it that the necessary guardrails are there. I proudly share with this august audience that we have been granted India's first patent in AI-based solution for mass screening of mental health just 6 days back on 7th October, and I humbly submit that our concept and services will be a global game changer, disruptor, and a revolutionary innovation democratizing mental health, which will not only counter stigma and taboo through anonymity and confidentiality, letting each and every Indian take care of their own mental health, but also help in addressing huge gap between demand and supply. It is made in India, by an Indian, by India, first deep tech startup, which will definitely lead to Viksit Bharat by 2047 as global leader in mental health services. Thank you.
Dr. Sandeep, Firstly, congratulations on receiving your patent for your mass screening solution. Ladies and gentlemen, questions? Yes.
Hi, Dr. Mamta.
Vijay,
This side, if I can start with. Dr. Vohra, there is a question regarding the implementation. This side, I think. Dr. Sandeep Vohra, hi.
Yes, hello.
Dr. Mamta Jain, Shri Agrasen International Hospital, Chief Operating Officer. So we were talking about the psychiatric health and mental wellness. So recently, the CGHS introduced first time in the history the psychiatric OPD, which was costing about 700 rupees, but they have not included any investigation into it. So my point is, number one, the CGHS, when the patient coming, many 60 to 70% patients are coming CGHS, CCHS and related, and those are patients who are actually going through depression and many more, and that's why we have to admit those patients in the medicine. Because as per all the insurance companies, CGHS, by rule, they do not admit the patient under the psychiatric. So what do you have to say, what you were saying 6 days back, the achievement?
Doctor, what you are speaking is curative part of it. Yes, of course, for that there has been already guidelines regarding insurance companies making it mandatory for them to see to it that mental health insurance is covering everything from OPD to indoor. So that depends on the regulatory authority to see to it that all these things are covered. And yes, this is the need of the hour. We must cover all these mental health services in CGHS.
Because patients are there. The
Yes, I
only
know.
thing, how to implement it.
See, what you are asking is the implementation in which CGHS people reimburse it.
Yes, yes, yes. That's what I'm asking. When you implement anything, any software, or I mean, as a hospital promoter, if I say that, yes, I want to start it. So how to give that facility to my patients,
so for that
which are majority
that-
coming from the CGHS
Yes, for that you have to get approval of a particular software from the government saying that it is approved under CGHS. Yeah.
All right, we'll go on to the next question, Vijay.
Thank you, Dr. Sandeep. That's an area of really a lot of interest for me. So I just have two questions for you. One is, does it work in children, and how young have you tested it, and what validation have you done for children?
Yeah, okay. So, most important question. So, it is applicable to any student who's above 13 years and above. Okay. It was scientifically validated. It was published in Indian Journal of Psychiatry in 2019. Then it appeared in American textbook in 2022 as one of the world's topmost scales. There are 2 scales more, and third has been listed in American textbook. And then WebMD's research director did a screening for work plus scales, and they chose around 160 scales, out of which 100 scales were chosen, which are applicable cross-culturally. Actually, I did not mention it. It is culturally neutral, so we can actually scale up. But I told you first India, and then USA are all over the world, because this is culturally neutral scale, and this is the only scale in psychiatry which is scientifically validated at preventive level. All the other scales existing are purely at the curative level. So if you see all over the world, including India and USA, corporate world uses, or others use PHQ-9. Yeah. What is the full form of that? Patient Health Questionnaire. So assumption is, wherever we are using, the person is already a patient. No, this is for normal population. Yeah. This is proactive screening. This is the fact that we don't want people to fall sick, as was being mentioned in your panel. That is what. So need of the hour is, why should we look at the people who are coming late for mental health problems? So if we use this is proactive screening, and of course, it automatically not only tells you what is your overall stress, but tells you from which area of your life is coming. And the most important issue is that people do not know whether they have to go to a psychologist or a psychiatrist. So automatic triaging, depending on the color, tells them that where you have to go. Yeah.
Thank you. That's great. And maybe my last question is, how do you think about it in terms of monitoring? How often you could do this test while you start treatment?
So what we do is, we are already doing it with University of California, San Diego. We are doing it with Apollo Telehealth, HealthNet Global. So what we are doing is, initially we are doing it after assessing, then we repeat it after 4 weeks minimum. But those interventions which are supposed to happen should be happening. Means, if I diagnose somebody has clinical depression, then therapy and medication should go. 4 weeks, then 8 weeks, like that. And ultimately, our plan is to bring quality care, and we call it as evidence-based, measurement-based care. So the biggest lacuna all over is, because of shortage of time, the doctors are not able to see exactly what is the degree of problem. So in this, we want to add measurement-based care, means once you are screened, the person who is having a problem, then the existing curative scales are given. So there is a measurement-based hierarchy, ultimately making it tangible. The most important thing wherever I go is, people ask, okay, we will give you this amount, but how do you ensure that this is tangible? So tangibility aspect is also covered.
All right, one final quick question.
Thank you, Dr. Vora. Just wanted to check, you mentioned about patent being granted to you. What's the primary claim? Because that seems to be the more rest, everything seems to be like a service, which anybody could replicate.
Yes. So it is machine learning and AI-based services for an individual, a mass, or a group.
Is it an Indian patent or global?
That is the reason I said India first. It is an Indian patent. My 10 patents all over the world are pending. So it is Indian patent which I have
Because I think there are companies like Calm and Headspace, they've already doing great amount of work in this area and mental health in general. So that's what I wanted to check. What is so unique about your invention?
So what I'm saying is, what they are providing is meditation, all these activities. What is unique about this is that if you tell me in this hall, if I want to screen, if somebody has a problem here, nobody will come out in open and ask me. So I have a solution which is totally stigma-free, and I will request CNBC-TV18 to give a QR code as a thank you note to all the participants who will go at home. When they go home at their convenience, they can just screen it, fill up the questionnaire, and get to know themselves whether they require help or not. So this does not exist anywhere in the world.
All right. With that, we'll have to wrap up. Many thanks, Dr. Sandeep Vora, for joining us today. Wish you the very best.
Thank you.
Again. And ladies and gentlemen, as we said, we've just started hearing these riveting conversations and stories. And we go back to something that I started the event and show with. The idea is not just to scale up, but to make this healthcare system that we take so much pride in far more inclusive, because it needs to reach the last mile. It needs to reach areas where it's still not accessible. And that's something that we're actually seeing really come out so beautifully in all these pitches that are being made. We'll, of course, continue with all our startup pitches, but before that, we also want to focus on one very, very key, interesting session and a conversation that you could have guessed by the kind of setup that you're seeing on the stage. So, ladies and gentlemen, now we, in fact, are going to move to a very interesting session on how digital transformation is really driving the innovation wave across the country. Digital transformation, as you would all agree with me, is the foundation that helps enable scale, access, and efficiency. And to really share insights on Digital India and the future of healthcare, we in fact have a very, very special guest with us, and we're extremely honored and privileged to have him with us. So, ladies and gentlemen, with a huge round of applause, join me in welcoming our next speaker, who in fact will be in conversation with CNBC-TV18's Ashmit Kumar. But with a huge round of applause, ladies and gentlemen, join me in welcoming Abhishek Singh, Director, General National Informatics Center, Additional Secretary METI, and CEO, Indian AI Mission, to really talk about what's really happening and what the future looks like. And we have our lovely moderator, CNBC-TV18's Ashmit Kumar, as well. Gentlemen, good to have you with us. Ashmit, the floor is all yours.
Well, thank you so much for that. I've been told we've been allowed 20 minutes, so we'll try to make the most of it. So as far as AI is concerned, I think anyone in this room who's done anything related to AI in the last 2 to 3 years, this is one name that you would have come across, that you've definitely heard of, that you've heard shaping policy, shaping direction, giving direction to the way India and its AI mission is progressing forward. And what's important is that this is recognized not just here in India. Mr. Singh has also been recognized as one of the 100 most influential voices as per the Time magazine. So that's clearly something I think that merits an applause for his efforts and the fruits of his labor that we're trying to actually benefit from. I'll begin, sir, with a small anecdote. I'm not taking names here just for purposes of privacy, but a senior government functionary that you work very closely with had a recent health scare. And in the course of that health scare, this gentleman, the senior government official, had gone to the doctor had done a CT scan, the CT scan had yielded results which were put on a CD, a disk. That disk was then taken to a Bengaluru-based startup, and then using AI, they had scanned the results of the CT examination, and very interestingly, they found anomalies which the CT scan had missed, which made for a completely different form of treatment by the doctor. Is this the future, sir, that we're looking at? An AI-enabled healthcare future that could yield results in this shape?
See, there are many use cases in which there are AI applications which are coming out with outcomes and results which are better than or equal to a normal specialist or a doctor. I would not say in all cases, but yes, just like if you have, so for example, radiologists. There are different levels of radiologists across, and sometimes you get one opinion and the radiologist concludes for some outcome, and then normally many hospitals, many doctors always advise you to take a second opinion. And then you go to another hospital, take maybe a superior hospital or a super specialty hospital, you get a second opinion and you get a different outcome. So outcomes can vary based on the experience and based on the expertise of the concerned doctor. What AI models is doing, that since they are relying on being trained by data from multiple sources, so over a period of time, many of these AI models, especially for diseases like tuberculosis or in some instances of cancer, their collective expertise is becoming a sigma of the expertise of all other radiologists whose data they have looked into it. So in some cases like ICMR and CDSO has approved some diagnostic protocols wherein AI bots can be used for diagnosing those diseases. So in some cases like in the case of tuberculosis and some ailments, the AI generated outcomes might be better than some of the radiologists. Not all, but in some cases it will be.
That's very interesting to hear, and this is where I actually want to bring in some of the experience that you have working with a lot of people within the startup community. As a part of the AI mission, you're engaged with numerous startups, you're speaking to a number of stakeholders, founders, investors. Can you tell us, can you give us some indication that this AI-led healthcare journey is headed towards, gauging from your experience working with the startup ecosystem?
When you look at use cases and when you look at applications wherein AI will create a lot of value, AI will benefit a lot of people, healthcare is one of them. And apart from diagnostic, apart from identifying what ailments are there, what possible scenarios can emerge, AI can also play a big role in preventive healthcare. Very often, many deaths in India are caused because people don't have access to basic information. Like, for example, we do hear news numbers of people dying of something as simple as diarrhea. And that happens because people who are suffering, sometimes they don't even have access to basic healthcare or a specialist who can tell them what to do. And the solution for that is very simple. So if such solutions can be done through an NLP-based, voice-based system wherein people could just ask a bot or call a toll-free number and give a query in their mother tongue and get a reply back, it can be a game-changer thing. Similarly, cases of screening, like cataract screening or diabetic retinopathy, the cost of screening is sometimes very high because we don't have specialist doctors in remote hospitals. That can really kind of benefit a lot of people. What we have also seen is that the load that they are there on the super specialty hospital, like hospitals like AIIMS and all, they have a lot of load of OPD patients. But therein, we are trying to do speech-to-text solutions for generating the prescriptions and electronic health records. There also it can play a big role in saving the time that is that's taken by the doctor to write a prescription or key in the prescription. If a speech-to-text is done, it results in great outcomes. The Shrikant Nadamuni's project of the 10-bed ICU. The 10-bed ICU project has also used AI in a big way in order to ensure that ICUs can be set up at a low cost in remote areas, and these ICUs are connected to doctors at the other end, and they can prescribe the treatment protocols. They can even do speech to text. The nurses, the data flows directly to them, and analysis is done that's given. In eSanjeevani project, which we are doing telemedicine, what we have seen is that patients can communicate to doctors and each one of them speaks in their own language. So a patient can talk in Hindi and a doctor can speak in English or Marathi, and each one of them listens to it in the language of their choice. There are multiple use cases of AI, NLP, data analytics AI modeling, which can transform healthcare. So startups who are working in this space have a lot of opportunities to create value, to build products which can enable access of affordable healthcare to people across the country.
In fact, when you talk of use of AI, just as an anecdote, in fact, while I was discussing this same issue with a few people with some of the large LLMs that we currently have in place, what they were indicating is that one increasing use case that they see is actually people seeking private therapy using some of these LLMs where they have private issues, they're not able to put it out, they have hesitancy in terms of discussing it with a third person, and they find that level of proximity with these LLMs in trying to actually help resolve personal issues. Just using that as an indicator, how much of an acceptance this transition between developing the solution and actually implementing the solution at scale, how big of a gap is that? How do we do that?
Again, while there are a lot of people who are using it for all kinds of purposes, and even for mental health and therapist jobs are also being kind of taken up by some of these bots. But at the same time, we also have to be a bit cautious with regard to how much we depend on them. Because most models are also known to throw up responses which might not be totally correct, or in some cases do not conform to the law of the land. One simple example is that, for example, in India, pre-birth sex determination is banned by law. It's not allowed. But I have come across models which are currently available on which if you upload the ultrasound image of a expecting mother, the model tells you the gender of the child which is to be born. So in a way, those models which are not having safeguards built to abide by the law are causing, not only violating the law, but can result in reversing a lot of gains that we have made on female infanticide and other issues. Similarly, for some ailments, the model may give you responses which might not be totally correct. So we do need to be very cautious. We do need to ensure that only those applications are actually rolled out, or those applications are deployed at scale, which are certified by the health practices, by the health experts, by the health regulator, whether it's the Central Drug Control Authority or the ICMR or Ministry of Health. They need to kind of say for what purposes it can be used, what purpose it cannot be used, and one has to be very, very cautious when we are deploying that. Those which have been tested, certified, can be deployed and used. It's nothing different than the way treatment protocols are approved or medicines or vaccines are approved. It's just like a technology which is similar to the technology for developing a drug or developing a treatment protocol, and it can be deployed only when a concerned regulator has approved it. So before deployment, before scaling it up, these precautions are also as necessary as going gaga over the power of these solutions.
You've referred to one challenge, which is, of course, ensuring that there is enough testing before a solution is deployed at scale. Let me pose another challenge to you, and this is with respect to privacy. Whenever we talk about training of these AI models, we're talking about vast volumes of data. But at the same time, this is very sensitive, personal to every individual, to every patient. How do we balance those concerns? What role do you see DPDP playing here, as and when it does come into play? The rules, of course, are awaited.
See, the Digital Personal Data Protection Act clearly lays down the obligations of the data fiduciaries in the way they are going to handle the personal data of the data principals. It lays down the data fiduciary is allowed to process the data only for the purpose for which the data principal has given him access, for the duration for which he has given him access, and doesn't authorize him to share with any third party without a consent. So the same principles of DPDP Act will be applicable to any AI model which is taking any personal data of any individual or a citizen for the purpose for which they are going to give the service. So they will need to abide by that. They will need to ensure that there is no violation of personal data in any kind.
Just on a slightly different tangent, any indication that you'd like to give our audience, any indication that you'd like to leave this audience with as to when we can expect the DPDP rules? A lot of excitement as to when it comes in, how will it be implemented, any indication, any teaser that you'd like to leave the audience with?
I don't deal with the subject, but for the Cyber Law Division, what they have told me last, because I do believe that one of the entities who will need to comply with the DPDP rules will be the government, and whether it is part of the India AI mission or whether it's part of the Digital India initiative that we are implementing, we will need to conform to the rules. So we are also awaiting the rules as eagerly as anyone else. So hopefully, from what the indication that I have heard is that it can come any day.
Wonderful. Let's move ahead now. Let's talk about the role of the government. You're also the CEO of the India AI Mission. You've worked extensively. Some of the work, some of the announcements that we've seen, we at CNBC-TV18 have reported extensively, whether it's 38,000 GPUs, whether it's the allocations, whether it's the startups that you're working with. Just an indication, going forward from here, using this as a foundation, what role do you see the government playing in engaging with the startup community, with specific sectors such as the healthcare space, with GCCs, the role that you see for the government?
The role of the government is an enabler and a kind of providing the initial push with regard to what all can be done. Like, for example, for AI, the whole world expects India to take a leadership. Unfortunately, we have been a bit behind China and the United States. We need to catch up. We need to leapfrog in order to be able to match up the abilities that these two countries have. And for doing this, we had done a lot of consultations across industry, and the feedback that we had got was that we need to invest much more in compute, we need to invest in R&D, we need to provide support for foundation models, we need to build datasets platform, we need to provide funding support to startups. So with that in objective, the 7-pillar India AI mission was approved. But what the government is doing is just is the first step. What we do believe is the industry will come forward and do much more. And the same thing we have seen, like the entire investment on 38,000 GPUs, it's not that the government has done the upfront capex investment. The capex investment is done by the private sector. Government is only subsidizing the end usage. But that has led to a significantly higher investment that has come from the private sector. Like the government budget for India AI Mission is around 10,000 crores, but 38,000 GPUs costs around 20,000 crores. And this investment has actually come from the private sector. So the role of the government is to be the enabler, to provide an ecosystem in which data sets are available, the support, financial support wherever required is available, compute is made available at an affordable cost, and rest of the innovation will be done by our entrepreneurs, by our startups, by our industry, by our researchers, because they have the talent and they have the abilities to build something of scale, and that is what will help us catch up with the best in the world.
We've seen various PLI schemes. We've seen the Indian Semiconductor Mission. We've seen the India AI Mission as well. Given the response that you're getting, you mentioned 38,000 GPUs ordinarily would have cost 20,000 crore rupees. You've managed to do that and a lot more in just a fraction of the budget. Going forward, given the response, do you feel the room for maybe expanding the scheme even further, or perhaps take it up a notch higher? Is that something that you think can be considered, is something that you'd want to maybe consider?
There is no reason not to do it, because the indication that we have from the highest levels in the government is that we have to do anything and everything possible to support the Indian startup ecosystem, the Indian deep tech ecosystem. We do have the capabilities, we do have the talent. Our engineers have contributed to the growth and expansion of almost every big tech company across the world. So once we have that element, then any support that they may need to build the products in India and not to leave India and go and contribute to a Perplexity or an OpenAI or to a Microsoft or to a Google, the government will be there to provide support so that these products which we hear and we use are built in India, and we start using Indian products which become global commodities in days to come.
You talk of Indian founders and Indian products. One Indian founder and one Indian product that in fact has been doing the rounds for the last few weeks, I dare say, at least on social media, has been Zoho. Mr. Vembu, of course, going out there, he's pitching for Indian solutions, which will in fact compete with some of the largest companies in the world. Just earlier today, in fact, Shireen, our managing editor, had a very interesting conversation with Mr. Vembu. He was talking about the role that he sees GCCs playing as far as the AI journey is concerned. He had a very interesting take. He said, GCCs are coming to India because of our large talent pool, because of the scale and the opportunities that India provides. His proposal was, let's tax them, and let's mandate them to have IPs resting here in the country. Is that something? Is that workable going forward, where we ask the GCCs to not only come here, but to innovate in a way that the IP rests here, that they get taxed here as well, they get regulated here in India?
See, Sridhar Vembu has built this product for a very, very long time. It's not that it's a new company which has come in the last few years only. They have a very robust team across the world. They have been building classic products in CRM space, office space, and the government also selected them almost more than a year and a half back. And though it has become news now, when we have actually migrated and we have started using the products, so Sridhar Vembu has a lot of value in what he says. The GCCs have led to India moving up the supply chain. What has happened was that earlier India's IT ecosystem was primarily known mostly for outsourcing and for basic low-level work. With GCCs, the higher-end work also has come to India. And as far as taxation is concerned, I am sure the revenues that is accrued to the GCCs in India is taxed in India. It's not that they have a tax exemption, they do pay taxes. With regard to IP, they will need to work out the mechanisms in which we work out what is the contribution of the GCCs in India to the overall IP generation. And maybe we can come out with a framework in which the companies who are building such solutions in India, they also kind of reside the IP in India so that we can get more resources. There are companies like, I think Accenture, who have more than 50% of their employees actually in India. There are, Capgemini also has a very big presence within India. So more and more companies are moving to India to set up GCCs, to set up operations. So very often many of these companies can be viewed as an Indian company rather than a non-Indian company. We are also seeing the developments in the West which will ultimately contribute to the countries who are not wanting Indian engineers to remain there for a long period. So it can be a huge opportunity to ensure that those engineers who are residing in these countries and providing services there can move to GCCs and start providing services. That will lead to increasing the proportion of the IP or proportion of the work that these companies have globally. And when that happens, we will be able to truly say that yes, these companies are more Indian than being non-Indian.
So you believe there is a case to be made for having the IP rest here in India for these GCCs?
Like it will depend on what company, what proportion of IP. In some cases, it will be a significant portion. In some cases, it will be a lesser proportion of the overall IP. So we'll have to see what is the contribution that we are making before we start claiming IP rights.
Wonderful. Let's steer back to the healthcare space. One gap that you see in the healthcare innovation space, and how do we address that gap? How do we fill that gap?
See, like the level of trust that people can have in these systems. Like, for example, in the entire healthcare ecosystem, what we find, especially in the tier 2, tier 3 cities and rural areas, like very often people have more trust in the chemist which gives the medicines rather than the consultant who prescribes the medicines. And we have come across, people say that dawa to yahi de raha hai, wo consultant kis liye fees le raha hai. So similarly, when we are building in tech innovations, we have to try to position the value AI applications are doing in the entire health ecosystem. And when people are made more aware of that, that would result in more utilization of them. And the second thing that will be required is that the regulatory framework for ensuring that health applications are properly tested and they conform to the responsible AI principles in healthcare. We need to do, RBI recently came out with a free AI report for responsible AI framework in financial sector. So similarly in healthcare also maybe we'll need to come out with a framework which will ensure responsible, ethical, safe and trustworthy deployment of AI. So that's one gap that is there which we need to address.
You think the acceptance of technology, we have one of the largest telecom markets here. There's a great digital divide that has been covered over the last few years. You think that acceptance, like you said, there is more trust in a local dispensary, a local chemist than there is on trained technology. You think that that gap can be bridged using technology alone, or are there other inputs that are required, say perhaps from the government or from the private sector?
I think given the example of the way technology has been embraced by India, like for example UPI, there's an absolute level of trust of people in UPI. Even when a vegetable vendor hears that 20 rupees prapt hue, or he sees a tick mark on his phone, he knows that the money has the same level of confidence of money coming in his bank account as otherwise he will feel a 20 rupee note or a 100 rupee note. So it's, the trust has been established with the lowest section of society with UPI. And if that can happen, similar thing can surely happen in healthcare, provided we build it in such a way that all concerns of unethical usage or responsible usage is also addressed.
That is such a fantastic example, and I think one example that all of us can relate to, that very often when we go to a local vendor to make a payment, quite more often than not, the vendor would not even bother checking if the payment has been made, because it is that trust factor that has now been built into it, that yes, the money will come, mera paisa kahin ja nahi raha hai. So that trust factor that you're referring to, I think a very relatable example. But that, unfortunately, Mr. Singh, is all the time that we have. We wish we had more time with you. We'd love to actually get more thoughts from you, more insights from you. But that's all the time that we have. Mr. Singh, I'd like to thank you once again for being a part of this conversation. And we wish you the very best on this India AI journey. Thank you so much.
Thank you, Ashmit.
Thank you, sir. Thank you so much. Before I let you go, I'll request you to come together for a picture, please. Ashmit, also thank you so much for moderating that conversation for us. Thank you once again. Before I move forward, I have to say this, for someone who hosts shows on a day-to-day basis, I'm truly privileged to have you as such a fantastic audience for keeping up the energy, the enthusiasm, and of course, the curiosity. So thank you so much for doing that for us, and continue with that energy as we move forward. But that truly was a riveting conversation, ladies and gentlemen, and what a true reminder for each one of us of how policy and technology really come together to drive inclusive innovation, two big words that we really have been talking about with almost every pitch that we've seen as far as the startups are concerned. But ladies and gentlemen, we now go back to our stars of this evening. We've seen some pitches, and we like to continue that journey by now inviting our next startup as part of HealthX Elevate Startups 2025. Ladies and gentlemen, with a huge round of applause, our next startup is Lenec Technologies Private Limited. With a huge round of applause, ladies and gentlemen, join me in welcoming Siddesh Kumar, the co-founder and Chief Product Officer, who in fact will be joining us on stage. Thank you so much. The floor is all yours.
Hello, everyone. I'm Siddesh Zakar, co-founding Lenec Technologies with Chirag Agrawal, who is also a co-founder. We both are alumnus of IIT, and we have graduated in 2019. So I will just tell you from where we have started. We have started in 2021 in the second wave of COVID, when we were both thinking of starting our own venture. Then suddenly, in the second wave of COVID, there was a scarcity of oxygen. So we have just started, let's build the oxygen concentrator, and it will give us the boost that we have needed. So in the span of 1 month, we have prepared the oxygen concentrator, and it gave us the lot of confidence that we really can build the medical devices in India. After that, we started our venture in October 2021 and incubated in IIT Kanpur, where we are developing currently point-of-care medical imaging devices. So the problems that we are solving are limited accessibility, high turnaround time, shortage of radiologists, and import dependency. More than 80% of the medical imaging devices are imported in India. So we have two products which are to be commercialized. One product is commercialized, and one product, LexiZen, which has to be commercialized. So this is a handheld X-ray generator, which you can carry in a bag and do the X-ray at anywhere. So this is a 3.5 kg less weight, and it has long-lasting battery. You can do the more than 100 exposure using this X-ray machine. And imaging quality is also high compared to the existing portable X-ray generator. Secondly, we have the Lenec Intelligent Radiology Assistant. Currently, we have integrated the AI for chest in this platform. So what features it has is, in the first level, it categorizes the chest X-rays into normal and abnormal, which itself reduces the lot of workload on the radiology. Secondly, we also provide detection of tuberculosis using chest X-rays, and with several 8 pathologies, we are providing 8 other pathologies for AI interpretation. So the workflow for this software is very simple. We just have to integrate this with the existing modality. The cases will be uploaded to the system. Automatic segregation will happen. Identification of pathologies will happen, and accordingly, the radiologist can draft the report. On the other segment, we are doing R&D for 2 devices. This is portable ultrasound system. So this is supported by ICMR as well. So we have currently established the POC for some of the modules in this device, and we will soon be completing the R&D for this device as well. On the AI front, what we are doing is we are targeting PHCs, CHCs, where all the modalities such as ECG, X-rays are easily available there. So what we are targeting is we are building AI so that when patient from rural segment come to the CHC, PHC, first level of triaging can happen at that place only. Okay, if the patient is related to heart, if the patient is related to TB, cancer, or other pathologies. So this is what we are targeting. So we are doing the multimodality AI approach for this. We will be using ECG and X-ray for initial screening, then the confirmatory can be done with the echo. So this is the competitive landscape for our Lexis device. We have the high throughput and price is very low. And as we have done the complete R&D in India, we have the high portability and high image quality. For the current Lyra features, we have this competitive landscape, Genki from Deep Tech, QXR from Q.ai, Insights CXR from Lunit, CAD4TB from Draft Imaging. So this is our team, me and Chirag. We have Dr. Deepak Padmanabhan from Narayana Health, and we have Devendra Chaudhary as well, who is from Switzerland, and he is mentoring us. And we have the 4 professors from IIT Kanpur who helps us in development of these medical devices in IIT Kanpur. And we have a small team of full-time 10 employees and 11 part-time interns. So far, our journey with the ICMR is we are supported by ICMR. So this handheld X-ray device and the Lyra, these both are mission mode project launched by ICMR to develop point of care, to develop made in India medical devices. So this is our manufacturing facility in IIT Kanpur. This is office space, storeroom, sampling and everything. So far, from using the software, we have raised the 1 crore worth of quotations from this device only. We have done the validation studies in St. John's Research Institute in Bangalore, in the Ashwini Hospital in Solapur, and we have also deployed this software in CHCs and other hospitals in Uttar Pradesh as well. So regulatory status of both products as in Lyra, we have the CDSCO manufacturing license for sale. And for Lexis, it is in the regulatory approvals as of now, and we are expecting those approvals to be completed by January 2026. So these are our milestones for the couple of next few years. So 25-26, we will be commercializing both our products, and by 26-27, and we will be doing the R&D for our CVD and the portable ultrasound machine. In 26-27, we will be validating both the ultrasound machine and the CVD, and we will be expanding both these Lyra and Lexis devices. And 27-28, we will be launching both the devices, both the portable ultrasound and CVD. We will be having 4 products, and by the end of in the financial year 28-29, we will be having the complete expansion of both all 4 devices. So yes, open for questions.
Thank you so much, Siddesh. Any questions? Yes. Can we have the microphone?
Hi, I'm Rajiv Gupta from Campus Angel, Chennai. How many devices have you produced till now?
So we have currently 2 devices, and 2 are in the R&D phase.
And what's the revenue like?
So for Lyra software product, in the last month, we have received the CDSCO manufacturing license. So currently the onboarding of some customers are going on.
All right.
And Lexis is in the regulatory stages of now.
Thank you.
Any other questions? If you could kindly raise your hand. We'll just get a microphone there, but let me ask this gentleman till then.
Thank you. My name is Arvind Mehta. My question is very simple. Once you scale up, how are you planning to service in terms of AMCs, etc., in your startups?
So for the device, Lexis hardware device you're asking about, right?
Yes.
So we are planning to collaborate with the existing manufacturers. So we are even in talks with them as well. So initially we won't be able to service our products, so we will be collaborating with those.
And what is the approximate cost per unit of the ones that you're developing?
Can you repeat?
what is the unit cost of these devices?
So for the hardware Lexis generator, the cost ranges from 2 lakhs to 3 lakhs. For the software, it is a credit-based system. You have, for 1,000 X-ray cases reporting, we will be charging 8 to 10 rupees, just like that.
One more question, yeah.
Yeah, hi. I'm Dr. Saurabh Bansal. I'm a surgeon by profession. Interesting innovation. I just want to ask a very common thing to you. It's such a portable device, like a camera. How will you protect the radiation risk? Because in hospitals and all, we have a separate radiation risk protection rooms.
So as the radiation leakage is less than 70 nanogray, as it is a very battery-powered device, so there is not enough radiation leakage for this device. So you can do the screening in the open areas as well.
All right, that's
So
all
do
the time.
Do you require any certification with ARB?
Yes, we require BIS, ARB, and CDSCO for this.
All right, that's all the time we have. Congratulations, Siddesh, and wish you the very best with Linux Technologies.
Siddesh, thank you so much. Shruti, thank you so much. Ladies and gentlemen, before I invite our next startup, just reminding the guidelines remain the same. The startups that are going to pitch on stage, you have exactly 5 minutes for that presentation and 5 minutes for the Q&A. Also, a humble request from those in the audience that are asking the question. It will be great the next time around if you could just stand up so the rest of the room could also see you, identify yourself, and then take the question. So reminding our lovely startups once again that 5 minutes for your presentation and 5 minutes for a Q&A. But let's keep the momentum going, ladies and gentlemen. I'd like to now take this opportunity to invite our next startup with a huge round of applause, ladies and gentlemen, welcoming our next startup, Vigris AI Health Tech Private Limited. Join me in welcoming the co-founders, Chirag Goyal and Chanchal Goyal. Let's have a huge round of applause as we welcome them, and the floor is all yours.
Hello everyone, a very good evening to all of you. Myself Chanchal Goyal and he is Chirag Goyal. We both are the co-founders of Vigris AI. So we have founded Vigris AI in November 2022 with the missions to make healthcare smarter, safer and more human again. So we have multiple AI agents in healthcare which save doctors' time in clinical documentation, helping them get paid faster and keep patient data safer. You have seen in multiple hospitals, doctors spend 60 to 70% of their time in admin work. Nurses retype the same data, and I just want to show you in the next slide how we are solving these issues.
Introducing Vigris AI agents, सहयोगी, एक स्मार्ट AI हेल्थ केयर असिस्टेंट जो पेशेंट का पूरा मेडिकल हिस्ट्री कलेक्ट करता है और उसी के अंदर बिल्ट इन क्लिनिकल डिसीजन सपोर्ट सिस्टम CDSS के थ्रू इंटेलिजेंट डायग्नोसिस प्रोवाइड करता है। आज के टाइम में एक्यूरेट डायग्नोसिस तभी पॉसिबल है जब पेशेंट की कहानी और क्लिनिकल डेटा दोनों क्लियरली समझे जाएं, और सहयोगी यही काम करता है सीमलेसली। पेशेंट सिंपली अपने सिम्टम्स बता सकता है। फॉर एग्जाम्पल, अगर किसी पेशेंट को स्किन एलर्जी है तो वो अपनी एलर्जी की फोटो अपलोड करता है। सहयोगी तुरंत एक कॉन्वर्सेशनल फ्लो स्टार्ट करता है, जैसे क्या ये इची है, कब से है। ये स्टेप बाय स्टेप क्वेश्चनिंग से सहयोगी एक डिटेल्ड पेशेंट हिस्ट्री बिल्ड करता है। सहयोगी सिक्योरली डॉक्टर के डैशबोर्ड पर ये फाइल ट्रांसफर करता है। डॉक्टर के पास 2 AI पावर्ड टूल्स अवेलेबल है, वॉइस MD और लिपि AI। वॉइस MD अलाउ करता है डॉक्टर को पेशेंट के डेटा को रियल टाइम वॉइस डिक्टेशन के थ्रू रिव्यू और अपडेट करने के लिए। डॉक्टर सिर्फ बोलता है और वॉइस MD ऑटोमेटिकली पेशेंट रिकॉर्ड में स्ट्रक्चर्ड EMR एंट्रीज क्रिएट कर देता है।
हेलो डॉक्टर।
हाँ जी, बताओ क्या तकलीफ है?
मुझे 3-4 दिन से फीवर आ रहा है और बॉडी पेन भी बहुत हो रहा है और मेरा सर फटे जा रहा है।
ठीक है, अच्छा खांसी भी हो रही है तुम्हें?
हाँ जी, खांसी भी होती है।
ठीक है, सो द प्रोविजनल डायग्नोसिस इज डेंगू फीवर। एक काम करो, एक तुम मेडिसिन ले लो पैरासिटामोल BD 1 हफ्ते के लिए। 2 टेस्ट करा लेना, लिपिड प्रोफाइल और डेंगू का टेस्ट। ठीक है, और मेरी एडवाइस ये रहेगी ठंडा पानी अवॉइड करना और 1 हफ्ते बाद वापस दिखाना।
तो देखा आपने कितनी जल्दी रिपोर्ट रेडी हो गई। ये मल्टीलिंगुअल सपोर्ट भी प्रोवाइड करता है, जिससे पेशेंट की डेटा को इंग्लिश, हिंदी या रीजनल लैंग्वेजेस में एक्यूरेटली कैप्चर किया जा सकता है। वॉइस MD के की फीचर्स हैं रियल टाइम वॉइस टू EMR कन्वर्जन, multilingual support, automatic structured medical records, reduces typing time, enhances workflow efficiency. Second one is Lipi AI. Lipi AI allow करता है हैंड रिटन नोट्स और प्रिस्क्रिप्शंस को डिजिटली कन्वर्ट करने के लिए. डॉक्टर के हैंड रिटन इनपुट्स, प्रिस्क्रिप्शंस और रिपोर्ट्स को लिपि AI स्कैन करके 95% एक्यूरेट डिजिटल टेक्स्ट में कन्वर्ट करता है. लिपि AI के की फीचर्स हैं हैंड राइटिंग रिकग्निशन एंड डिजिटाइजेशन, एक्यूरेट प्रिस्क्रिप्शन कन्वर्जन, seamless integration with EMR, reduces manual errors, improves documentation speed. ये दोनों AI टूल्स यूज करने के बाद पेशेंट का कंप्लीट मेडिकल रिकॉर्ड फुल्ली अपडेटेड, एक्यूरेट और इजी एक्सेसिबल हो जाता है. डेटा सिक्योर रहता है, एनालिसिस अपडेटेड होता है और वर्कफ्लो फास्ट और एफिशिएंट बन जाता है. पेशेंट के लिए ये इंश्योर करता है बेटर केयर और स्मूदर एक्सपीरियंस. थैंक यू.
Any questions?
Majorly it was the pitch, but all the agents are live, and we have our business model is basically with integration with EMR, HIMS and PACS companies, where they integrate our SDKs directly. It is a end-to-end plug-and-play solutions, and it is for nurses, doctors. So we have different agents, except radiologist is not multilingual. Rest everything is multilingual. And we have a blockchain-based health locker to make it secure and end-to-end encryption on the patient data. So I think
Sure.
open for the questions.
Any questions? Please keep them crisp. Yeah. Let me get across a microphone to you.
I'm Dr. Sangeeta Sharma. I'm former director of National Institute Tuberculosis Respiratory Diseases. My question to you is, how do you ensure that if there is a discrepancy which emerges, how are you going to deal with that? You know, discrepancy with what your software uploads and the real examination, if it reveals a different diagnosis, how do you plan to, you know, settle that?
So ma'am, two things. First, your question is related to clinical decision basically. Once it is taking all the inputs from the patient and giving all the information to the doctor, in the video it shows differential diagnosis. It only suggests that these could be the probable diagnosis, high probability, medium and low, with a reference case study, which we are already having medical discharge summaries and the prescription, which is relevant and similar to that case which is the patient belongs to. Second thing is, at the same time, suppose doctor is not taking that differential diagnosis, which is already tested in majorly hospital, it is accurate, but if doctor is taking other things, other treatment plans, and it is again dictating and doing other things at the same time, because the work of voice MD, speech to text, is to recognize at the same time parallelly also CDSS work. Like suppose you have a history of some allergies and everything, so drug interactions and everything is always taken care by CDSS. So how the flow works?
Yeah, excuse me. I have a question. I'm here.
I think
we are
we've
pressed
actually
for
run
time.
out of time.
Yeah.
Unfortunately, we will have to move on. Shruti, thank you so much. That's all the time that we had. But let's have a huge round of applause as we thank the co-founders, Chirag and Chanchal, for their presentation. Ladies and gentlemen, moving on, we now want to invite and take this opportunity to invite our next startup. With a huge round of applause, join me in welcoming Primary Health Tech Private Limited. And joining us is Sahil Jagnani, the founder and CEO. Sahil, the rules remain the same. 5 minutes for your pitch, and then we'll try and take some questions. Request to the audience to try and keep their questions crisp as well.
Good evening, everyone. I am Sahil, founder, Primary Health Tech Private Limited, and Ankit is my co-founder at Primary Health Tech Private Limited. What we are actually working on is to provide lab-grade results within 30 minutes for a general practicing doctor. And these are POCT devices but are validated across 10 hospitals. We recently got the HTA done with ICMR, where there was an 8-month-long study where we have validated the device, got the certificate, and the device has performed very well compared to the Roche instrument, which is a fully automated 2 crore rupees instrument, and our device is 100 times less in price, less in size, and it is a 100% digital solution. This device has been initiated at IIT Guwahati with the support of Ministry of Electronics, Information Technology and ICMR to build the indigenization of the medical device in India. So we started in 2018, where we started the blood testing device manufacturing in India. We did 3 years of prototyping and validation and then the regulatory approval. We have now CDSU approved device and the ICMR approval has also been done. The vision of this device is going to go into the doctor's clinic. So we are actually targeting clinics where the doctor is there and the ecosystem around the doctor we are trying to solve. So let's suppose somebody wants to go for a general problem to a doctor. Now the doctor is going to prescribe you the blood parameters. It may be a simple test like HbA1c, but the patient will get the report only after 6 hours in a city, but in a remote area, it will be a day or two when the patient has to come again for the diagnosis next day because there was no device which can give the instant blood testing facility available at the clinic. So what we are trying to solve is the TAT, normally it is 6 to 12 hours, we are reducing it to in 30 minutes where all the general parameters can be given in the device. The profitability for the clinic is also going to be increased because normally the lab tests are being given to a diagnostic facility where the margins for the doctors is reducing. The big problem that also we are trying to solve, let's suppose somebody is using the device in a remote area, the reliability becomes a very important question. So because of the digital intervention, we are solving the reliability issue where what we have done, whatever is the technician is going to do at the clinic, everything is synced automatically at the back end where there are different dashboards, there are different applications which make sure the results are accurate and these are diagnostically approved results. So the journey started in 2018. We did prototyping, we did the validation. Now we have 2 products which are validated, tested and already deployed in 150 plus clinics and we are scaling the solution to more clinics this financial year. In terms of competitive landscape, if you see, the comprehensive testing facility was a miss in all the clinics which are available right now at the doctor's clinic. There are tests like glucose, hemoglobin which are available, but not the comprehensive testing is available. Plus, the speaker has said that the digital workflow is an important thing that has to be looked into. So our device directly plug into a doctor which is directly available at the clinic or maybe a teleconsultation platform where the system will directly integrate using the API or the SDK integration. We have 18 plus patent. There are 7 hospitals where the validation has been done, including AIIMS New Delhi, 5 publications. And this device is also now AI enabled as well. These are the 50 parameters that are available in all the 150 plus clinics which are portable. The device you can see, this can also be carried in hand. It weighs around 7 kg and then all the blood testing can be done within 30 minutes at the doctor's premise itself. Now we have also integrated the CBC. So these are the general parameters which is required by a general physician. We are also doing R&D where the prototype has been ready for immunoassay-based testing where the thyroid vitamins are also going to be integrated by March. The validations are going on. We also have 2 patents for cancer diagnosis as well, one for oral and one for cervical cancer. But these products will also be available in next 6 to 8 months. What we have also observed that solving and making a device was an easier problem, but the adoption was a key challenge that we were trying to solve because the adoption of the medical device takes, even the Abbott and Siemens of the industry are also taking 12 to 18 months to get the adoption of the device done. And being an Indian startup, this becomes a very crucial because nobody trusts initially the Indian-made products. So what we have done is that we have also gone one step ahead and we have made a train.ai application or the AI tool which will make sure that the training is reduced from 6 months to 15 days, 2-3 days in coming future. And what we have done right now, we have actually made the tools which are very easy to understand in vernacular language, step-by-step instructions are given. And also all these things are also automated, wherein let's suppose somebody is making some instruction to the application, all those data are recorded at the back end. So whenever somebody is doing the test, every step is monitored so that the accuracy improves. The second is that Once the report is generated, then there are no pathologists who are going to sign the report, or the pathologists are burdened enough, so they are not using the report. So now we have also coming up with the patho.ai, which is a smart tool where every report is going through that tool. So 90% of the pathologist work is now being reduced using our patho.ai platform, which is now again a first phase of deployment. But as data are generated, we have 2 lakh patients data has been tested now. Now it is all going to be integrated where the patho.ai will reduce 99% of the work of a pathologist, and it will actually open new doors where new things can be done. For the patient level, definitely this tool is going to come in future, not now, but again, we are actually having a platform where we are managing the data very well that can be used in future. This is a 3-layer process. There is a hardware which is patented. Then there is application and dashboard, so everything is digital. And then there are AI tools that we are working on that will also be integrated very soon in future. We have 2 lakh patients test has been done, and 150 plus deployments have been done. These are the different use case of the device. Doctor's clinic is one of the most important things.
Sahil, I apologize for interrupting. Your pitch time actually is over. We now like to take a question, if there's any question.
Any question from the audience? Can we give it to this gentleman, please? Sir, I can just... Please keep it crisp. We are pressed.
I am Dr. Makashir. I am a pathologist myself. So you're going to definitely impact we people. The first thing I want to ask is, again, this is a portable one. You keep it at a doctor. But how are you, who is going to take the blood sample? Or without the blood sample, just by blowing, you can find out all these things. So
Yes.
this is the most important part which has not been touched.
No, definitely your question is valid, and we are also facing these kind of challenges. But what we have done, we have recently trained 200 DMLT, MLT to use our machine. So these DMLT and MLT people are also going to be positioned with the doctor so that the device can be used. Plus, we are also training the compounder. So the doctor mostly have a compounder or a nurse who can also be trained with the device if they know how to withdraw the blood with a certification. Or also, we are also creating our own fleet. So definitely, it's a challenging proposition. But definitely, we will be able to find out a solution so that we can solve this problem.
All right, Sahil, and we'll surely keep a track of that. Many thanks for joining us today.
Thank you so much.
Thank you so much once again. Let's keep the momentum going, ladies and gentlemen, as we now take the opportunity to invite our next startup on stage. With a huge round of applause, let me introduce our next startup. Our next startup is Geo Innovations Private Limited. Join me in welcoming Siddharth Andrish, the CEO and co-founder, on stage, please. 5 minutes for your pitch, and then we'll take a question, please.
Good evening, everyone. I hope everyone is doing quite well. So I'm Siddharth Andrish, CEO and co-founder of Geo Innovations, which we believe is world's largest chain of last-mile AI-enabled healthcare distribution centers. So a little bit about our team. So Geo is founded by 2 IIT Roorkee graduates and a pediatrician doctor. And about myself, I did computer science from IIT Roorkee 2004. And then did master's in computer science again from US. And then I was in US for about 10 years in machine learning domain, working at Apple and Netflix. And we have Dr. Meghna Sharma with 20 plus years of practicing of this pediatrics, MD pediatrics. And then we have Avil, the third co-founder, who is an operations workforce and has again 20 plus years of corporate experience. So we are Chandigarh based, we are 32 employees right now. And a few pictures about our team, office and all. And over last 6 years, we have been operating. We have received several recognitions, awards, the most recent being the Best Startup Award from Tycon Chandigarh earlier this year. So the premise of founding Geo. So before that, and in the early phases, our focus was to find a large, important, and unsolved problem from India, okay, and gain unique expertise while solving it, and deploy the solution pan-India and beyond. So
Our focus has been on the rural and semi-urban healthcare, which is a big problem in India and even outside. The problem is lack of access of quality healthcare at so many places. Right? And there are 600,000 plus villages in India with not a very good presence of qualified and specialist doctors. And at the same time, there's a great opportunity that those same villages have around 15 lakh plus small pharmacies run by some pharmacist degree holders, those kind of people. At Geo, we have created an ecosystem, an integrated ecosystem to provide multiple value-added services to increase the capacity of these pharmacists operating in the rural and semi-urban sector. So the Geo Mitra e-clinic, this ecosystem, the bouquet of services, it has primarily an assisted video consultation system with all kinds of specialist doctors. And then pharma products, many of which are Geo-branded products, medicines. And then diagnostic products, which includes the standard ones like blood work and this AI diagnostics as well. And some well-being products like geriatric products, women healthcare, women hygiene products. So we also have deployed and continue to pilot several AI diagnostic products like an eye scan to detect cataract, a face scan to detect vitals, the symptom checker to engage with a last mile healthcare provider, increase their capacity, knowledge, and all. And our intent of piloting these things is to get more mind share of these pharmacists. So I'll play a video for 30 seconds, which will showcase what happens inside a Geo Mitra e-clinic. In this video, the gentleman in black dress is a pharmacist who is running a Geo clinic, and the lady in pink sari is a patient, and the one in the mobile phone is the Geo's doctor.
मैम इनका जो पैर है दिख रहा है घुटने के यहाँ पे स्वेलिंग नहीं है और यहाँ पे जैसे टपकन जैसी दर्द बनी रहती है, हर्ज में बहुत तेजी से दर्द होता है और ऐंठन रहती है मैम। जी जी, लेकिन मैम गार्ड के नीचे, जॉइंट्स के नीचे है यहाँ पे साइड में।
एक्चुअली क्या है कि जैसे जैसे जब थोड़ा ऑस्टियोआर्थराइटिस हो जाता है ना।
So you could have seen that a very detailed discussion about the patient symptoms and history took place with the doctor, the qualified doctor over phone, aided by the medical worker, the local medical professional who happens to run a pharmacy. Okay? And this has very high chance of leading to a much more accurate diagnosis. And since it is being run inside a physical pharmacy, medicines are immediately available after that, and several diagnostic services as well. And this creates a good ecosystem for a better follow-up going forward. So this leads to a better patient satisfaction at a Geo e-clinic because several services are available right there. And also the patient, the rural or the semi-urban patient, does not face the inconvenience of talking to a specialist doctors all on her own. Sometimes that could pose issues. So we have several revenue streams based on the clinics. The gross margin of these range from 35% to 60% based on what they are. And over the years, we have seen that the Geo e-clinics, they typically operate like an OPD department of a tertiary healthcare hospital like Fortis or something like that. We see patients of very great variety for both chronic and acute patients. And over last several years, Geo's patient repeat rate has organically increased from 20% to 40%. And we have published several research papers on the patient impact, the outcome at Geo e-clinics, studied over many complicated diseases like nephrotic syndrome, thalassemia, and recently a paper was published in Stanford Social Review on Geo as well. So Geo combines both impact and business together. On the left-hand side, there are some screenshots, maybe difficult to see. I'll be happy to forward these things, of very complicated diseases being treated at Geo, sometimes taking even more than 6 months or so. And on the right-hand side, there are some products, Geo-branded products, available at the same e-clinic. So it's happy to inform you guys that Geo has been crossing the rule of 40 in our current situation over the last couple of years. So with 30% YOY growth, 28% gross margin, and 15% EBITDA. So kind of happy to see that and grow that thing. And another interesting thing is Jio's average MRR, revenue per e-clinic, has shot up from rupees 815 in 2020 to 5,800 in the current year. And we are targeting 10,000 MRR in the next couple of years.
Siddharth, unfortunately, your pitch time is over. We'll try and take one question now, please.
Yes, one question, if you could kindly raise your hand. Or I'll just ask a quick one, Siddharth. You've got AI tools like, facial scans and symptom chatbots integrated into care delivery. Quickly, if you could tell us, how are you validating diagnostic accuracy and, of course, most importantly, ethical safety with the data that you get?
Yep. So we source these products from other suppliers, like third-party things, and we go over their licenses, and secondly, we run several health camps to validate their ratings produced by their devices versus what traditional devices, if any, they produce. So that comparison gives us, confidence in what's going on. And since we have many doctors on the platform, they frequently validate anything we introduce on the platform.
All right. Thank you so much and wish you the very best.
Thank you, Siddharth. Thank you, Shruti, for that. Ladies and gentlemen, let's keep the momentum going. And this is an opportunity for me to now invite our next startup. Our next startup is HealthTech Private Limited. And joining us are Srishti Srivastava, founder and CEO, and Nidhi Sehwag, senior psychologist, on stage, please. 5 minutes for your pitch, and then we take a question, ladies.
When I was 12, I froze on national television. I was one of the 320 child geniuses to take part in India's Child Genius. But I developed social anxiety symptoms, which got me in contact with the dire circumstances of the Indian mental health ecosystem. Namaskar, I am Srishti Srivastava, founder and CEO of Heal, a graduate from IIT Bombay that went on to study psychology. And this is our senior psychologist, Nidhi Sehwag. We discovered 4 major gaps in mental health ecosystem. We discovered that mental health was a stigma, mental health was expensive, mental health was not really accessible, and we also found that there were too many apps out there trying to solve a problem without any interlinking. We felt like this could be solved through an AI therapist, which we sought to build in 2022. We soon realized in 2025 that ChatGPT already says that therapy and companionship is the #1 use case. And we also simultaneously find cases of ChatGPT-induced psychosis. We also find cases of hallucination rates being very, very high in large language models, which tells us that we are on the right track. We also realize that we can solve this through our own data sets. And that's why we started building our own data sets from scratch by leveraging data sets from all over India. After fine-tuning our models, I think there's a problem with the slides. After fine-tuning our model, we found that we were able to cater to B2C users as well as B2B users. We not just built an AI therapy app, we also integrated several other features on our platform. We had mood trackers, we had journals, we had in-house therapy sessions as well on our platform. We've had 4 lakh users since its launch last year. It's been roughly a year since we launched this. We've had 35% month-on-month growth. We've had people from 165 countries using our platform. We also had our first B2B success story in the form of Lupin. When Lupin actually integrated our SDKs onto their platform, they saw an increase in downloads of roughly 40%, and they saw a 30% engagement rate increase. We also have partnered with Google, NVIDIA, and OpenAI. We had Prime Minister Modi mentioning us in his Mann Ki Baat speech, and we also had endorsement from Jensen Huang. Our future lies in building NVIDIA of healthcare, servicing all the new age companies with LLMs, SDKs, anything that they require in an AI dominant world. But it all begins first with a good consumer app, and that's why we're here to launch DuoChat. DuoChat is actually world's first AI relationship counselor.
So I would like to take this space to introduce DuoChat, which is designed to help people handle relationship conflicts, but more thoughtfully. I am pretty sure you guys might have situations where a conversation with a loved one, maybe a partner of yours, a friend of yours, even a colleague or maybe a parent, went down the hole of, being defensive. Your words were misunderstood. Emotions tend to run high in those high intensity conflicts that we often forget about rationality in the conversation. And what tends to happen is, instead of solving the problem in the relationship, we end up, ruining the relationship. And this is the particular problem that DuoChat is solving for us. Think of it like a wise, emotionally intelligent guide in the room where both of you are having a conversation. Now, it will not disrupt your flow of conversation in each and every time that usual AI responses would do. Two people, both of you would be having a conversation, and wheresoever it senses that, words are being misunderstood, the conversation is being derailed, somebody is being disrespectful, it is being escalated. At that very point, Hilo interjects in the conversation. And not just any kind of interjection, it asks you the questions. The right kind of questions, which would help you to explore your needs, which you won't be able to, voice out because you have some defensive working on unconsciously. We often tend to have that in relationships. We, of course, want to save our face as well. It will ask you to voice out your emotions, your needs, your preferences in a respectful manner, asking you questions without being defensive. And this is not about who is being right, who is being wrong. The goal here is to feel heard, to feel understood, to feel seen, so that both the people, regardless of the kind of relationship that people have, can work towards solving that particular problem and reaching to a shared resolution. So in
please
short,
support us in our launch of DuoChat.
Yeah.
And we're really happy to do this on this stage. Thank you so much for this opportunity.
Thank you. Any questions, please kindly raise your hand. Can we get a microphone there? Request to kindly stand and be crisp.
I'm Dr. Imran Nurani. I'm a senior consultant in Sir Gangaram Hospital. I'm a psychologist myself. It's a wonderful app. Just to know, how will you compensate for the human content which happens in person of therapeutic interventions all over? How do you compensate for that emotional connect with a person sitting in front through this AI digitized mental health service that you will be providing?
So we have a human-in-the-loop system. This is capable of handling roughly 85% of the low-risk cases that we get on our platform. And it's actually trained on actual therapy data. So it simulates like real empathy. And when necessary, for high-risk cases like psychosis, suicide, we actually match people to therapists and distress helplines. So that's how you have the human in the loop constantly.
Congratulations.
Hi, we can take one more question. Yes, ma'am.
Hi, I'm Dr. Himani Narula. I'm a developmental behavioral pediatrician. And my question is, what is the age group for which you're using this?
So typically we get people from the ages of 18 to 35 on our platform. And we are also working on a model that can work for students which are younger, like 14 to 18 age group.
And what about the medical legal aspect, consent for conversation or the privacy of the content that the client is talking about?
So we follow HIPAA compliance and we are CDSU approved. And we basically follow all the guardrails in our system for high-risk cases, and we also have a human in the loop, so that takes care of the medical legal aspects.
And anytime something has to be relayed to the therapist, there is of course a written consent being taken, so that we can transfer that particular data to the therapist, because otherwise they will have to repeat their case history again and again.
All right, that's all the time we have. Thank you so much, and congratulations, Team Infield. Thank you.
Thank you, ladies. Thank you, Shruti. Let's keep the momentum going, ladies and gentlemen. Time for us to invite our next startup with a huge round of applause. Join me in welcoming Pratibha HealthX Private Limited, and we have the founder and MD, Pranay Garg, joining us on stage. Please, 5 minutes for the presentation, and then we take a question. The floor is all yours.
Thank you, Shruti, and I promise to walk you guys through our journey, the outreach and impact in the next 5 minutes. Our value lies in building for the last mile within communities, which spans across the spectrum of prevention, diagnosis, treatment, and rehab. This addressing all segments of the population, which includes rural, tribal, and urban populations as well, in two distinct models, which I'm going to be talking about in this presentation. We have touched more than 5 million people over the last 5 years or more with our go-to-market partners, again, which we will talk about in detail. The team that delivers on this promise has expertise in various fields that include business, AI and product strategy, building tech, and delivery as well. We are also supported by functional advisors to be able to deliver on our promise. The care gap we solve spans across risk access, and rehab, amongst others, that align with Sustainable Development Goal 3, addressing coverage, access, and care delivery, bringing good health and well-being for all at all ages. We align with the test, track, and treat continuum for primary care. While aligning with the future of healthcare, the theme of this evening, we monitor episodic, continuous, continuous, coordinated, and value-based care that brings wearables, AI, and deep tech converging into a unified platform. Data convergence, actionable intelligence, and delivery is pulled together in a simple 5-step workflow that includes sensing vitals, processing and scoring, segmenting them into the red, amber, and green for triage, care coordination, and then closing the loop. The Unified HealthCon platform is your healthcare enabler from risk to recovery. Intuitive workflows enable efficient capture, analytics, and care delivery across population segments. Our impact journey has been impressive. We have touched more than 5 million people, as I mentioned, at the base of pyramid through joint go-to-market implementations in many Indian states, which have touched more than 600 primary health centers and health and wellness centers. Frontline health workforces have enabled the assisted model and have proven the concept at scale over the last few years. From a stakeholder value perspective, we are looking at hospitals and public health programs, sponsors that include governments, NGOs, and foundations. We aspire to now be able to work with insurers and employers. From a competitive landscape perspective, where HealthCon stands out as opposed to the next best alternatives is, again, providing solutions that span across screening, risk stratification, triage, treatment, and rehab. We are one of the only solutions that combines AI risk scoring, natural language processing, summarizations, wearables, and point-of-care integrations across assisted and do-it-yourself models. A market size which is very impressive and is expected to exceed $500 billion by 2030 in the listed segments, would have the United States having the largest market share at approximately 44%. The fastest growing region being the global south, comprising approximately 34% of the market share. So that's really impressive and an area of interest that we would like to be in. From a recognition perspective, more recently, HealthCon was amongst the top 5 innovations at BioAsia 2023 and was also listed amongst the top 50 healthcare companies by the International Forum for Advancement in Healthcare at Dubai in 2019. We have been the choice of market leaders and are now focusing on the global south as well, having proven ourselves in the Indian subcontinent, where open innovation and go-to-market partnerships drive differentiation in the marketplace. Thank you very much.
Any
I think
questions?
I stuck to my time. Thank you.
Yes, you did. Any questions? All right. You've got one from me. You've touched, almost over 5 million lives till date. Can you share with us some of the specific outcomes or ROI indicators that sort of validate your impact at population scale?
So, implementations in the Northeast, where our population screening has included non-communicable disease screening as well as communicable disease screening, we've been able to provide actionable intelligence to the sponsor, which is the state mission director, on number one, the health of communities. And fortunately, in 3 different demographies like the hills, the valleys, and the plain. And then also be able to segment from a big data analytics perspective, male, female health, down to, so segmenting on all of that, as well as communities, down to the individual. And the number of people added to this category of non-communicable diseases and communicable diseases during that particular month.
All right. Okay, with that, it's time for us to wrap up. Thank you so much for joining us today here and wish you the very best, Pranay.
Thank you very much. It's been an honor.
Thank you, Pranay, for that presentation. Thank you, Shruti. Let's keep the momentum going, ladies and gentlemen, and time for us to introduce our next startup. Join me in welcoming Platnoid Technologies Private Limited, and we have Saurav Das, the CEO, and Surjit Das, the CEO, who in fact will be taking the stage and making their presentation. Gentlemen, you have 5 minutes for your presentation, and then we'll take some questions.
Hello. Am I audible? Yeah. Hi, I'm Saurav, founder and CEO of MyRx. We are a teleconsultation as a service company, and perhaps we are the company who enabled 10-minute medicine delivery in India. So we have been the backbone of multiple companies who are actually trying 10 minutes medicine delivery like Zepto, Blinkit, Amazon, and PhonePe also. So we are 3 founders, in fact, Saurav, Neil, and Surjit. All of us have collectively 16 years plus experience. I'll just quickly get into the numbers. Currently, we are doing somewhat around 3.5 lakhs teleconsultation in a month. We have been seeing 40% month-on-month growth. Along with that, we have touched 10 CRs ARR, and next year we are trying for 100 CRs. And we have 300 plus doctors in-house currently, 200 plus pharmacists with us. Best part is it's 24/7 and the SLA. We connect the patient with a doctor within 6 seconds, although we are committing a SLA of 10 seconds, in fact. So 96% of the time, we are able to connect the patient with a doctor any hours of the day within 6 seconds, and that's what we call as accessibility, in fact. So the current bottlenecks, what we observed in the market was like, it was only scheduled consultations. Either it is a GP, CP, or maybe any super specialty. It was scheduled. We have to schedule it. So what we tried to build in is like instant teleconsultations, how we made it possible with the volumes of quick commerce and expanding it to the different sectors, keeping super specialty doctors in-house with us. There was limited capacities, and along with that, the minimum consult was somewhat varying around 35-40 rupees. We have been able to brought it down till 20 rupees, in fact. And that is something we called it as affordability. And apart from that, there was no systemic support, in fact. We are doing almost 80% audit in-house with our panel of pharmacists and doctors, keeping the accountability as well as the auditability in place. So these were the challenges, these are the challenges like 10-second doctor connect, affordable and scalable, automated and audit ready. This is a quick workflow. We don't have a B2C model. We generally go ahead with B2B players. They have their front applications wherein the patient interact with those customers, and then the backend part is being handled by MyRx Doctor Engine. And this typical process, we take it up in hardly 4 to 5 minutes, in fact. This is the tech which is powering the speed, compliance, and scalability. So we have an in-house team of techs. So entire tech is built in-house, and this is how the complete tech works. Due to lack of time, we'll not dig deeper into it. But the highlight is we have been a market leader for quick commerce, e-commerce, and e-pharmacies with almost 78% share with us. And we are hoping to increase our shares over there. And once we have captured the e-commerce for industry, we then expanded it into hospital clinics, along with that insurers and TPAs, apart from the D2C companies, diagnosis partner, and wherever there is a teleconsultation need. Managing doctor is not an easy activity. Getting order is also not an easy activity. Attrition is very high, and we are trying to solve that. So how we tap on doctors, in fact. So generally, our doctors are all MBBS plus, and more or less 1 year experience, and most probably preparing for PG NEET, and super specialty, they can practice from anywhere. There is no entry barrier, in fact. On an average, we are able to make somewhat around 30,000 for a part-time doctors monthly, remotely, without coming to office or anything. And a full-time doctor, 65, which we commit with, as a minimum guarantee. But however, we have seen doctors earning more than 1.5, 1.6 lakhs every single month. And the attrition has been lowered down to at least 8% as of now, from 33% when we started last year. This is our AI roadmaps. In fact, we have doctor scheduling, rostering, and along with that, we have CDSs, we have OCRs, and along with that, automated call auditing system. And this is how we are keeping the compliance ready. Why MyRx? Yes, we have a great pool of doctors. We take care of the trainings. We take care of the audit part. We do it 24/7. And the best part is we connect the doctor in 10 seconds. Thank you. Open for questions.
Well, that was crisp, very sharp pitch. Any questions? Kindly raise your hand. Yes. Can we have a microphone there quickly?
Thank you. I am Dr. Anand Vasudev from Delhi and practicing pediatrics and nephrology, pediatric nephrology. My question to you is that suppose you have given a teleconsultation and patient has some problem and he wants some clarification. So how are you going to address that part?
So we have the prescription being delivered to the patient, wherein there is a QR code, and along with that the numbers of the contact center. They can reach us anytime.
They would do it digitally, or they can speak to the person?
No, they can speak to the doctors also. They can schedule that part.
Right.
All right, a quick question there, sir. Can you just give a microphone there to that gentleman? Can you raise your hand, sir, and stand up? Yeah. Very quick question.
I think you are working for B2B basically. Just want to understand if the customer is using this, right? If I am a customer, I'm using it through some platform, reaching out to you, and again I'm coming back. Are you going to connect with the same doctor? Or you're going
Same
to
platform.
Same
And
platform, same doctor.
there is a sticky agent, in fact. So in fact, if you want to have a word with the same doctor, it is possible.
So if I want to have, but
Yes,
how,
yes. And
do I need to select it something, or it will go straight to the doctor?
No, there are options, in fact. If you want to get connected with the same doctor or a different doctor is fine.
Okay, one more thing. You said from 10 CR ARR to 100 CR.
100 CRs, yes.
What is that going to be different than?
E-pharmacy is growing, in fact, and this is limited with only 4 cities as of now. We have expansion plan of almost 84 cities with Blinkit and Zepto. Apart from that, Amazon and many more players are coming in. Insurance is coming. So we already have a lot of hope and expectations from the market?
Well, it'll be quite interesting to see how you're maintaining quality and compliance while operating across, such varied verticals. You've got e-pharmacies, you've got D2C brands on board. But many congratulations and thank you for joining us here. Thank you so much.
Thank you very much.
Thank you, gentlemen, for indeed that very, very crisp presentation. Thank you, Shruti. And ladies and gentlemen, now completing this very, very inspiring lineup, presenting our last startup presentation for this evening. Join me in welcoming Visvis AI Private Limited, and we have Siddhartha Gadre, the director, joining us on stage. Please, you know the drill by now. 5 minutes for your presentation, and then we take a question, please.
Hi. Hello. Hi, good evening, everyone. My name is Siddharth, and I'm the co-founder of Visvis AI Private Limited. We work in a very niche space of physiotherapy, musculoskeletal physiotherapy. What we actually, all of us in this room, I'm sure have directly or indirectly visited a physiotherapist, have undergone physiotherapy, and typically what happens is you're suggested to do 8 to 10 sessions, then you're required to exercise, continue exercising at home, and that's where a majority of patients drop off. There is a huge amount of non-compliance on the part of the patient. Patients end up making mistakes, and then they resurface after maybe 2 months, 3 months back to the doctor, and the recovery hasn't happened the way the doctor was expecting. So that's where we come in, where we've built a very simple computer vision enabled assistant for physiotherapy. This idea was conceptualized about 3.5 years back. Dr. Babulkar had operated my shoulder, so I knew him pretty well. We got together, and so I bring in the tech experience, he brings in the credibility, he brings in the knowledge that is required for physiotherapy, for orthopedics. And what we've built is basically a library of exercises. We currently serve various conditions for the shoulder, knee, hip, ankle, neck, and back. It's a very simple application that surgeons, physiotherapists use with their patients in 2 forms. One is a setup that we set up inside a clinic of a physiotherapist, and where the patient can come, they can engage with the platform, they can undergo exercises with the assistance of a virtual physiotherapist. We track human motion and posture, and that's how we track whether the patient is completing their exercise protocols, whether they're doing any mistakes, whether there needs to be any correction of form or posture. Then the patient migrates to a home rehab app where the patient who needs to continue exercise for a few more weeks, maybe sometimes 2 months also, they get this protocol on their mobile apps, and where they can exercise from the comfort of their home in a very cost-effective manner. What I'll show is a very simple video of
Welcome to Wizio, where we push the limits to design solutions that help you deliver great quality physiotherapy to your patients. Do your patients struggle with joint and muscle pain? Do you find it difficult to engage patients during physiotherapy? Are you looking for new techniques to get your patients to stick to your physiotherapy plan? Now grow your practice by harnessing the power of AI within your clinic. The Wizio AI Coach can be set up in a small space inside your clinic. Select from a range of modules and exercises for the whole body. Our proprietary computer vision programs track the patient's posture and movement to guide and engage them during exercise. Track the patient's range of movement and pain through intuitive assessments and reports. Our team will help you to set up the system. It consists of an iPad and a TV that is connected to the camera and the Wizio AI application. Assign a program or an exercise to get your patients to exercise more, improve compliance, and objectively track their improvement. And it doesn't end there. For those patients who need to continue exercising at home, you can use the Wizio Home Edition app. Assign a specific program for a specific number of days to ensure patients recover faster and better. Get complete control on your patient's physiotherapy journey using the Wizio Physiotherapy Assistant. The daily performance and assessment reports are now available to you at any time. It does not matter if the patient has exercised in the clinic or at home. Track your patients seamlessly through the entire ecosystem. With some of the best surgeons and physios, using the Wizio platform, our condition-specific programs, guided by AI, are revolutionizing home rehab for patients and clinicians. Join the Wizio platform to help your patients recover better.
Yes, so this is a screenshot of how the system looks for the physiotherapist. Our business model is very simple. We sell to hospitals, surgeons, physiotherapy clinics. They in turn then use our services with their patients. How they monetize it with their patients is something for them to decide. We have a very simple payment structure with the healthcare providers in place. Currently, we are live in India, Middle East. We are now, this month, we will start our foray into the US market also. In US, of course, because of the strict regulations, we are entering there as a research use only vertical right now. We've got a Saudi FDA completed. We will soon complete our Indian CDSU approval also. So far, what we've done is, I'll jump to the end of the slide. So far, what we've done is we've done about 50 lakhs of revenue in the first 6 months of this year. We hope to end this year at about between 1.5 to 1.8 CR. The plan to expand in the Middle Eastern and US markets is quite aggressive. I think we should do really well there because the need of this product for that market is even more pronounced, where patient wait times are as high as 4 weeks, 6 weeks for a simple physiotherapy consultation. The cost of physiotherapy is also not entirely covered by insurance over there. And accessibility to high quality physiotherapy is also not, or the ease of finding a physiotherapist is also not as easy as it is in, here in India. Market is significantly big. I think I will rather answer your questions if you have any. Thank you so much.
Sure, are there questions? If you could kindly raise your hands. All right, if you could elaborate, Siddharth, on how you validated the 95% plus condition improvement claim that was, I want to know what was the clinical protocol or the control set that was used.
Yes, so just a correction there. This is not a clinically validated trial that I'm talking about. These are study trials that we are currently conducting with patients. The measurement is basically there are 3 sets of patients that we take. One is a category of patients that are undergoing an in-person physiotherapy protocol with a physiotherapist. The second is a set of patients who do online physiotherapy, not with the app, of course, with the physiotherapist. And third are those category of patients who are only using the Visio application. And here what we are seeing is that we are seeing very competitive results when compared to current methodologies of physiotherapy. In-app assessment is there built into the workflow. We are not a diagnostic or a prescriptive tool, so these reports are sent to the doctor, but these are not, we are very clearly stating that these are not meant for taking direct actions, but we use standard shoulder pain and disability index or a Tegner-Lysholm index. There are various ways of assessing pain of the patient in a questionnaire format. Along with that, we measure range of movement. So whether my shoulder abduction is now at, say, 90 degrees, after 15 days, it's gone to 140 degrees. So that progression also the doctor gets to see on a bi-weekly basis. The third parameter, which is strength, is something which we cannot measure at this point in time. We will come up with some solutions for it in future.
All right. Congratulations and wishing you the very best with all your global expansion plans. Thank you so much, Siddharth.
Thank you so much.
Thank you, Siddharth, and thank you, Shruti. Ladies and gentlemen, that really brings us to the end of the presentations of this evening. A big congratulations to all our startups. Yes, that truly deserves a huge round of applause. So thank you so much once again. Their innovation really reflected the best of what India's healthcare ecosystem really stands for. And we go back to where we started. Passion, creativity, and a very relentless drive to improve lives. So, of course, that has been very inspiring, and we hope many more stories will come out by the end of this evening. But, ladies and gentlemen, you'll agree when I say this, that we've seen innovation from the ground up. And now, ladies and gentlemen, it's time for us to hear from a leader who's helping shape the larger vision of healthcare transformation. With a huge round of applause, ladies and gentlemen, join me in welcoming Uma Ratnam Krishnan, the Managing Director at Optum India, to deliver and join us for a very special address. Please do join us, ma'am. Very good to have you with us. And the floor is all yours.
Good evening. It's an honor to be here today at CNBC-TV18 HealthX Elevate, a platform that brings together India's most pioneering healthcare startups, industry leaders, and government stakeholders. This gathering is more than an event. It is a platform. It is a movement driven by shared purpose to elevate the health outcomes for everyone. At Optum, which is part of United Health Group, our mission is to help people live healthier lives and make the health system work better for everyone. Today's showcase, what we just saw and witnessed from the HealthX Elevate Startups, is a testament to India's innovation potential. These startups are not just launching products. They are creating true outcomes. They're presenting visions which solve real-world problems with creativity, empathy, and scale. From AI-powered diagnostics to tech-enabled care delivery, the range and diversity of the ideas we saw were simply stunning. What, however, stands out is their clarity of purpose to actually help people live healthier lives. We must reimagine Indian healthcare, not just as a system of treatment, making it better, but actually as a platform for equity, empowerment, and wellness. We saw the possibility of somebody from a village in the Northeast being able to access immediate healthcare through telemedicine. AI could potentially predict outbreaks even before we know about it. That's not fantasy, that's pretty much reality. This isn't a dream. Let's move from reactive, hospital-centric healthcare to a much more proactive, patient-first kind of care. We saw a little bit about value-based care and preventive healthcare and proactive care. There are many models around the world which have actually espoused value-based care. It is different from fee-for-services. It is really about rewarding outcomes, looking at outcomes as the primary objective rather than just a set of treatments. There are many models which actually have embraced it. We are in very early stages of value-based care, but these principles of value-based care can actually help decongest hospitals, give people care they need at a much earlier stage, and hugely improve clinical outcomes. As we saw today, this is the best intersect of technology and healthcare. I tell the story about talking to a group of IIT students, and when we talked about healthcare and we said, how many of you are interested in healthcare? We had about 2 hands going up in a room. But if you look at it today, I'm so delighted to see that many of our startups are from IIT graduates, core technologists, but who've taken on the challenge to solve the huge healthcare problems of the world. Whether it's AI-enabled diagnostics, it's remote monitoring, it's delivery of care where the patient is, we're all democratizing access. But use of AI comes with responsibility. It has to be fair, it has to be transparent, it has to be clinically validated, and most importantly, it has to be culturally sensitive. India's initiatives, and we will hear more about that, are steps in this direction. We must build the global digital infrastructure that ensures interoperability, privacy, and with content and equitable access to make the impact of AI real. The government is playing a pivotal role in transforming this. The Ayushman Bharat the digital mission has enabled this. We have other schemes which are building those guardrails for us to actually integrate into the overall health system and make the outcomes significantly more impactful. I'd like to end by saying healthcare is not just a sector, it's a social commitment. Let's align the policies and the incentives to reward better clinical outcomes and better patient experience. We are investing in digital infrastructure. Let's train our clinicians in responsible AI, and let's empower these brilliant startups that we heard and the many more to come with clarity and the support that they need. Let's foster collaboration and build an ecosystem across the government, across the industry and private players, corporates, academia, and civil society, and commit to building a system that's inclusive, intelligent, and inspired by every citizen's dream. let's not treat illness. Let's build an India with health. Thank you.
Thank you, Uma, for those very, very inspiring words. And we, in fact, will just call you back on stage in just a bit. But that was so well said that look at all the presentations that were done by the startups today. They were not just making products, but in fact solutions for India that will help them not just scale up in the future, but also be far more inclusive. And that really has been our idea of getting this set of people together who, of course, give us a very optimistic picture of where India is headed. But ladies and gentlemen, next up we have a very power-packed discussion, which is also very aptly titled. It's called Reimagining Healthcare, Access, Innovation and Global Leadership. 3 words that we in fact have heard right from the start of these presentations and almost everyone who's come on stage today. So without wasting any more time, ladies and gentlemen, join me in welcoming the moderator of this session. Join me in welcoming Shireen Bhan, the managing editor at CNBC-TV18. Shireen, please do join us on stage. But ladies and gentlemen, keep your applause coming because we have a stellar panel that in fact is joining Shireen on stage. Join me in welcoming Dr. Indu Bhushan, ex-CEO Ayushman Bharat. Good to have you with us, sir. Always such a pleasure. Also join me in welcoming Dr. Naresh Trehan, Chairman and Managing Director, Medanta, the Medicity. Thank you so much, sir, for taking out the time. And also welcoming Uma back on stage, Uma Ratnam Krishnan, Managing Director at Optum India. Good to have all of you with us. Shireen, the floor is all yours.
Good evening, ladies and gentlemen. It's great to see you all here at what has been a fascinating evening of conversation, dialogue, on discussion on an issue that is very close to our heart at CNBC-TV18, something that we've been very, very passionate about over the last 25 years in our journey. And we're glad that Optum and CNBC-TV18 could come together to really dial down on what is needed in terms of the imperatives to take this conversation forward. I've got a stellar star cast here with me, so without further ado, we were just discussing before we came out that this is probably the nth conversation that Dr. Indu Bhushan and Dr. Naresh Trehan and I have had on reimagining healthcare for India. But, you know, while there has been a lot of progress, there continue to be many obstacles and many challenges. And so let's pick up on each one of them. Access, innovation, and global leadership. Those were the 3 things that we are going to focus on and discuss. So let me start by asking you, in light of the experience of putting together the Ayushman Bharat program, a flagship scheme of the government, that was really designed to solve for the access problem, the access deficit issue that faces Indian healthcare. What have been the biggest lessons? What have been the biggest learnings from that? As we look ahead, what would you now like to see being designed into the program?
Well, thank you very much. Thank you for inviting me. And, you know, Ayushman Bharat was launched in 2018. And if we just look at the scorecard of the scheme, I think probably we can be quite proud of that because more than 10 crore treatments have been given. And every year, the scheme is providing 2.5 crore treatments. And there are a huge number of studies to show that it has saved millions of families from falling into poverty. And so increasing access to healthcare has been only one of the achievements of the scheme. But in addition, Shireen, I must add that, you know, the scheme also has been able to mainstream the concept of health insurance. And so many hospitals which never had this kind of experience now are accepting health insurance, but also digital health. Yeah. Now it has mainstreamed digital health. And in addition, it has also promoted private sector investment in health. And earlier, because there was no demand for healthcare services from poor and in rural areas, we are seeing a lot of investment going into tier 2, tier 3 cities, rural areas. Private sector investment in health has surely increased. But coming to your point that what else can be done, you know, if you look at the scheme, we see still a large inequities in terms of different states. Southern states, western states, their rate of utilization is much higher, and northern and eastern states still need to catch up. Also, there's the issue of this missing middle. The large number of people who are still not part of any scheme. They're not rich enough to afford private insurance, but not poor enough to be eligible for Ayushman Bharat. So we need to focus on those. But the biggest constraint is this continuum of care, you know, this linkage between primary and preventive health care. And unless we focus on strengthening our preventive and primary health care, probably the scheme is not going to be sustainable.
You know, several important points that you raised there, and I'll get to each one of those. But let me ask you one which is pressing, because that keeps coming back to the headlines every few months, and that is the issue of disbursals, slow disbursals, no disbursals, forcing hospitals to say, we don't want to be part of the program any longer. Now, that's a real challenge. How can that be addressed? Pricing is separate. You know, we can argue about whether the price needs to be rationalized to keep in mind what the market pricing is and so on and so forth, so that you do get more hospitals to opt in and come on board. But disbursals, once a hospital has come on board, should the government not at least be not be tardy as far as disbursals are concerned?
No, I think there's no excuse for not paying hospitals on time. Of course, like you said, that we can always argue about the prices because, of course, those things are also evolving. But when the scheme was actually put in place, we had the provision that if we don't pay within 15 days, we'll be paying some penal interest on the amount. And of course, that has not been followed. But also, there's been delays in some of the states not allocating enough resources, because as you know, Government of India provides 60% and 40% comes from state governments. And many state governments have expanded the pool, number of people, but have not put the money where their mouth is. So that's why in some cases there have been delays in payments. But you know, I can't agree more with you that unless we make payments, this scheme is not going to work. Because the hospitals are not there, not for charity, but they need to make the ends meet. They need to pay their doctors, they need to pay their staff, they need to pay for supplies. And so unless they are paid on time, it is going to be putting a lot of burden on the hospitals. So no excuse, and that is something government should correct as soon as possible.
Dr. Thuran, let me address the issue that we just raised there with Dr. Bhushan as well. And he said, you know, hospitals are not charities. Not all hospitals are charities. But, you know, in the context of what we're seeing happen as far as private healthcare is concerned, and private healthcare, to be fair, in India, has solved the access deficit problem for the paying population, for a large majority of people who can pay for healthcare, at least in our larger cities. But now with the advent of private equity, and now Indian healthcare has virtually been taken over by private equity, do you believe that the missing middle that Dr. Indu Bhushan was talking about is going to find it even harder to be able to access private healthcare in the future?
You know, it should not happen, no question about that. There are some of us who have accepted Ayushman from day one. In fact, a little known fact that I am one of the first writers of the document for
I know, we had the two of you on. Yes.
Universal care. So, you know, like everything else, it has its own hazards in the sense that it is amazing and it's really heartwarming to see people who would not be able to access health care and always be scared of actually about how much it's going to cost, because you know the data that 4% of people before Ayushman came were pushed down from above poverty line to below poverty line per year, so that you can imagine what kind of burden it was for the poor people. Now the question is that they do have a sort of a support system which can take them anywhere. I mean, when I see somebody who never have been able to walk into the doors and come in and get a bypass surgery, it is really, really something that has happened. So, yeah. I mean, it's a great scheme. Inder has been the champion of it or creator of it, the final detailing, he did.
Yes.
And that's the amazing part. But what is the bad side of it? It has been hijacked by many, many, many people and states. It has become like a political tool some places. So you will see people coming out of Mercedes, diamonds dripping with a Ayushman card. So these are all dispensations done for political reasons. And so I think that we have to have proper regulation and some checks and balances where we know that where it's intended to go, it reaches there rather than being hijacked from on the way. So that was the other issue Dr. Bhushan has addressed about the payments. So it varies from state to state. That is a problem. And I don't think that there is a mechanism which says that when we started Ayushman and when you accept it as a state, there is an obligation which you have to meet, because the whole idea is that it is access for the poor people.
Yeah.
Some states are saying, okay, all the hospitals are saying we will not accept it anymore. Who suffers? The person who is actually most entitled but does not get it.
Yeah.
So I think that there has to be debate over it. There has to be implementation, enforcement. All sorts of things have to be done. And it varies from individual to individual who actually is at the helm to. So the Prime Minister, rightfully so, has actually championed it. Not only that, the first initial proposal was to make a 2 lakh per year cap. And in his concern or style, you would say, he said, no, 2 lakh may not be enough, make it 5 lakhs. And now addition of 70 plus years, getting another additional 5 lakhs is an amazing thing to do. But the payments must come so that everybody gets on board. And the rates, by the way, the new rates have just come out.
They've just come out,
and
yes.
After a long time, I think it's 6 years
Yes.
that it should have happened, but it's happened finally. And I think, also you can understand, it's a huge burden for the government, knowing very well that there's no country in the world that has been able to solve this problem.
Yeah.
Even the United States has more than 30 million people who are out of the loop. So I think it's a challenge all around. We all must play together. It's the patient first, it's the providers, and then there are the insurers. Whether it's government or whether it's private sector, it has to be aligned in a way that it is all focused towards the patient's care, not so much that profiteering or things like that.
You're absolutely right, Dr. Trayan, that it is not an India-specific problem. It is a global challenge. The health crisis or the healthcare crisis is a global challenge. And we're trying to see solutions from an Indian context. And Uma, that's what I want to address with you. What do you believe with the use of technology, with the use of data that we now have, with the public-private partnership examples that we've spoken of through the course of this evening, what should the next chapter look like in trying to find unique Indian solutions to addressing the healthcare challenge?
So, if you look at what the problems facing healthcare are, they seem to be pretty similar with different colors. I mean, I'd simply say access, and I'll talk about access in 2 parts. One is the actual access to healthcare when you need it. The second, with the current development of technology and with customers taking their healthcare journeys into their own hands.
Yes,
whether it's
chat GPT, your way to health.
Yes, it's your own personal doctor. The access to information regarding health and their own health journeys, right? So that is still a big challenge. In the Indian context, both Dr. Bhushan and Dr. Trayan spoke about how we're enabling access to actual care when patients need it. But from a customer journey and from a technology and an innovation perspective, I think a couple of things. The technology now, I mean, what we saw today, everything comes with an AI opportunity. But the ability to access and provide the right amount of information, guidance, immediate access, not entirely the end-to-end spectrum, but at least the initial access. We saw a phygital model, which in the Indian context would be interesting. It's not 100% digital model, it's a phygital. So the ability to access and use it, whether we use telemedicine, whether we use apps and scans and all of that. But that, I think, we're seeing some very, very interesting innovations from the Indian context, right? And I call our innovations frugal innovations because we always focus on lower costs. You know, the way to make it happen, I mean, we saw a lot of examples of that. And I think that could potentially be a huge opportunity for other global countries which want to create access but at a lower cost. The second thing I'll come to is cost. I mean, we all know that clinical outcomes, better patient outcomes is really our objective. But using technology for that, we've seen a lot of opportunity to reduce the friction in the clinical. But on the cost side, right, there are many, many things that we're seeing which will reduce cost. Reduce in terms of our medicines, you know, our ability to point people to generic medicine. And I talk a lot about preventive healthcare, which is can we do this earlier and earlier so we reduce the cost. And technology, again, plays a very important role in releasing capacity and lowering cost. Examples of, I mean, hospitals are busy, clinicians are busy. If we can actually use technology for actually improving workflows, getting earlier and earlier, simpler outcomes, that then also reduces cost. And I think some of our technology solutions, we're very good with managing resources, we're automating workforce, you know, training and the ability to be more productive quickly, and use some of the technology which maybe expand later around clinical, how can we automate some of the clinical friction, right? So I think the Indian context, our opportunity is huge, and our ecosystem for startups, I think can make a huge difference, but need to integrate it into the wider health ecosystem.
No, absolutely. We do need that integration with the wider ecosystem. We saw examples of what you know, young companies are doing at this point in time. But let's focus on the point that you raised as far as digital healthcare is concerned, because that's in a way the big hope of being able to solve for both access as well as provide the kind of innovation that's required. What have you been able to see on both those fronts at this point in time, and how do we get this integration that Uma was speaking of?
You know, Shireen, what we are seeing is that the confluence of digital health, which is digitizing records and ensuring interoperability, but confluence of digital health with medtech, new devices are coming up, IoT devices and wearables and others, and AI. And all three together, I think already in last 5 years, one can see the movement is improving access, because as you can see, there were some applications presented in the previous session when for telemedicine, and the government's telemedicine platform e-Sanjeevani has provided more than 300 crore or 300 million, consultations, which is a huge number. And many of those consultations are with the people who would have never have seen the kind of specialists they saw. Similarly, we are seeing the AI solutions which are very scalable and which are being used for screening of TB. And earlier, with the earlier technology, it was impossible to screen millions of people that we have in rural areas. Now, with AI solutions, it's much easier. So access has improved in a big way. We are also seeing that costs are coming down because many of these solutions are cheaper, and they are reducing the duplication. They are reducing unnecessary tests because they are more effective in some ways. And also, in terms of expanding the product, the efficiency of system, because now one doctor, can do much more with this technology, and the effectiveness has also gone up. So we are already seeing the trend towards better use of resources, better access to these resources, and but government still has a role to play in terms of incentivizing that these innovations are made for last mile. And I was really gratified to see that many of the solutions which were presented in the earlier session talked about the last mile and how to improve health services in rural areas. But more than incentivizing, I think government also has a role to play in terms of regulations. You know, currently, we were talking about it earlier that, you know, we are seeing some of the headlines in the newspaper that regulations need to be stronger. But for innovation, I think we have to have a sweet spot. If regulations are too tough, then we'll kill the innovations. But if they are too soft, then I think we are not going to be building trust, and in the long run, they're not going to help. So I think government still has a role to play in terms of ensuring that we have strong regulations, but also smart regulations which are promoting innovation, but at the same time building trust.
You know, I'm glad that you brought up this issue of regulation, because I think what you're talking about, and again, another tragic incident where we've seen the lives of young children being lost on account of contaminated cough syrups, and this is not the first time that we've seen this happen. The regulatory architecture that governs Indian healthcare, center, state, multiplicity of organizations, multiplicity of bodies, and hence the buck doesn't stop anywhere. The buck gets passed on from one body to another. You talk about the need for smart regulation, Dr. Indubhushan. What should the regulatory architecture for a new India for the healthcare services look like?
You know, in some ways, the complication in regulations has a past history, because many of our drugs are being regulated by the Act of 1940. It's a drug and cosmetic of 1940, and where after that, health is a state subject, and many of the rules are made at the central level. So drugs are approved at the central level, but license for producing those drugs is given at the state level. Now, states compete with each other in terms of attracting investment and attracting industry, and obviously they want to go slow on the regulations. And so whereas there is overlapping responsibility between center and states, I think that needs to be rationalized. And right now, if you look at it, health sector is the most regulated sector. And if you want to open a hospital, you have to take about 200 approvals. And every year, you have to do about 6,000 compliances. Dr. Trehan probably would know. And so it's a highly regulated sector. Still, things like those happen that you mentioned. So here, something, of course, is broken, and we need to rationalize.
More regulation is not the answer. More regulation is not the answer.
We are actually quite well regulated. We need to rationalize those, and we need to be slightly outcome focused. We should not be regulating the inputs, but should make sure that these regulations are meeting the output or outcome that we seek to achieve. For example, we should insist that hospitals should report readmission rates. They should report how many, what is the experience of patients which are going out. Like we have star systems for restaurants. Why can't we have star systems for hospitals? Based on the
as a patient, I couldn't agree more with you, and I will narrate a personal incident, because this is exactly what I've been dealing with the past week. There is no way to know, who you should go to, and whether you can actually see the history of the success as far as a particular physician or a surgeon, etc., is concerned. So I completely, from a patient's point of view, I couldn't agree more with you.
Absolutely, and maybe Dr. Trehan can tell us something about that. How can we make sure that hospitals are providing the services that can create trust? And, as a patient, when I go to a hospital and they tell me that these procedures are to be done, I always have a feeling in my mind that are these procedures required, or are they being told to me because they are linked to the revenue of the hospital?
Dr. Trehan, this is not the first time you've been asked to answer this question. You've been answering this question for as long as I've known you. But the two parts to that question there. One, let's start by talking about how has it gotten easier to actually set up a hospital in this country. Every budget, the industry is asked for infrastructure status. The infrastructure status has now come. Has that made life simpler, easier? Are we likely to see more hospitals being built? Are we likely to see more bed capacity being added over the next few years? That's number one. And two, how do hospitals become more patient-centric and more patient-focused in their approach and in their attitude?
Okay, so first one first, okay. So the question is it easier? Absolutely not. There is one thing is regulation, the other thing is policy, and then the implementation of both. Now, if along the way the implementer is going to hijack every opportunity that comes for reasons of their own, as I'm sure you understand, that there is no way that we can actually move along smoothly without actually being extorted. So it's a sad state that I'm saying this just now. Every budget says, we are going to have 75,000 more seats for doctors. Try and make a hospital. Try and get the state government to approve. I mean, I'm not saying much because I'm experiencing it myself. That there is a big problem. And the biggest problem, I think, is that health is a state subject. So it will depend upon the vision of the chief of that state and how much they can actually implement things, because everybody and anybody below will like to hijack and extort. It's not a good situation right now. And I think that we need to rein in. We talk about India next by 47.
Yeah.
The question basically comes, one favor Mr. Trump has done to us is to give us a little kick in the pants and said, wake up. Now, if we don't wake up, it's our fault, not his fault. So I'll give you an example. For 40 years, we've been very happy making generic drugs and waiting for patents to come off, making enough money, but we have not invested in molecule creation at all. Absolutely. So we have not given back everything. So I'll give you an example of hospitals, okay? Today, the cost per bed for any hospital which you would like to, or anyone would like to, whether they are Ayushman, whether they are CGHS, or whether they are private, it doesn't matter. Because the quality of care matters.
Yeah.
Okay? It costs 1.5 crores per bed to create. And that is not counting the cost of land. So it's a very expensive endeavor. The point is, everybody gets a bad name about saying you are charging too much. Indian medicine the cost is 1/10 of that of anywhere in the world.
Yeah.
Now, when you talk about how to determine quality, I was in New York for 20 years. We used to publish our personal results and institutional results and report it to the New York State Regulatory Authority, and they would publish it.
Yeah.
So it was so public to view. But there are now, minimum standard NABH. Then we have this double, so now we have we are JCI certified. JCI is Joint Commission International, which is the highest body for international rates. So that's one benchmark you can use to say, what is the quality of care? Because they go not only under the carpet, they even unplug the floor to actually find out what's the truth about yourself. Right. So I think we should publish our results. We should be forced to publish our results and then let it be. But now then you have to be honest when you're publishing your results. So this is like a vicious cycle. So first our own character has to improve. The national character has to improve. Unless that happens, all these things will have potholes in it. And that's why you know that there is uneven payment schedule. All this stuff is not very pleasant to talk about.
No.
So the thing is, look at only one fact. Most hospitals do not give bonuses or issue dividends, right? So the money goes into creating more hospitals, which is sorely needed. So it's basically a vicious cycle for all of us. Some are good, some are bad. That's in everything. Yes, you can talk about there are a few of us left who are doctors who are still running hospitals. Yes, a lot of it has been taken over by private equity.
Private equity or maybe AI at some point in the future, we don't know.
It'll happen, no, but AI is an absolutely fantastic coming.
Yeah.
We in medicine are so used to AI and machine learning, not from now, for many, many, many years. The question really comes is affordability, because when you want to transition to get the hardware and the software, and the renewal of license will kill most hospitals. So how is it going to be democratized? One way I can suggest is the government actually takes the license at a cost. And then everybody goes to the government and gets bits and pieces. And then you will be able to implement it very easily. But the way the IT industry works, it has to milk a license forever, which is not right. I can understand if it costs you to do something like in pharmaceuticals, at least there is an expiry of your patent.
Unless you evergreen, which is also quite the norm as far as the pharmaceutical industry is concerned. The evergreening of patents, of course, is a real challenge that we deal with also.
So that's up to you guys to actually respond to the request that somehow it has to be spread, the cost.
Yeah.
And if it can be spread, you will see a quantum leap in our ability to incorporate AI and other formulas of new generation into our practice and give a better quality of care. So I'll just give you 1 second. I know our time's up. The basic thing is, when we became doctors to treat disease. Then we said, why do we let this happen that the patient is so sick and then we try to dig them out of the grave? Why not do early detection? And that's when all the technology came in on MRIs, CT scans, all this other stuff came, right? Then we said, why let them get sick at all? Why not go towards wellness, right? Now, wellness is the whole thing started. The failure of ours was that only 3 to 5% of the people around the world adopted our recommendations for wellness. Because life is so good to live, and whoever created cuisine has done it so irresistible, made it so irresistible, that you say, somebody will say, I will say to somebody, paranthi khani band karo, right? And he says, Dr. Saab, asi te Punjabi hai, mar jaage. So what is your answer to that? Okay, so that's basically life is a trap. Yes, it is. So staying healthy is, but you know what can actually help you today with genome sequencing?
Yeah.
Today, whatever knowledge we have, our new diagnostics, you can write the health patri, like the Janam Patri of an individual, so that you know how to steer yourself and where are the ditches in your life, and it'll really help. It can be done today, and it's been miracle, because the genome sequencing used to cost almost 2 lakhs till 5 years ago. Today it's 10,000 rupees.
Yeah.
So that's basically, you can do the whole sequencing and you'll know where you are vulnerable. Your family history also tells you. If your genetic history tells you, you know where the things that you cannot even go towards.
So as we transition from the Janam Patri to the Gene Patri, Uma, and we're talking about democratizing healthcare in this country, lay out for us what you believe the imperatives should be as we close.
So I think a few things. One is the fact that I'm a big supporter of wellness, so completely agree, maybe too much food is really about creating models which will help us to deliver better outcomes much earlier on, less food. I don't know how we'll do it. But using data and analytics, to go back to Dr. Trehan's point, there's a real opportunity for us to use data and analytics personalized. To say, how can we change lifestyle? How can we change food? So using technology, but completely personalizing it to the individual, right? So to actually help create this. The second thing I would say is very, very patient-centric. Move away from doing services, number of tests, whatever we need to do, but to look at holistic outcome for the individual patient. Using all of the technology we have, using all of the commitment that our clinicians have. The third thing is make it simple and easy. Again, using technology to the extent that we can remove the friction out of the clinician's life. We saw some examples of that, but how do we actually create electronic records, single version of the truth, and how do we actually make it simpler and easier? And the last one I'd say is a bit of a combination. How do we create the rails, the digital infrastructure, which can be with consent, interoperability, simple, using the data, and hopefully with AI becoming cheaper and cheaper, and becoming more open, but using it responsibly, but actually leveraging the digital infrastructure that the government is creating. And I think from the government's perspective, my ask would be to say, let's do whatever we can to improve adoption, encourage people, whether it's providers, it's patients, whoever it is in the ecosystem. So I'd like to see the imperatives across all of this, but eventually leading to a completely interconnected health system, if we can, which keeps the patient at the center.
Absolutely. I think interconnectedness and interoperability are crucial as far as patient care is concerned. Dr. Trehan, I'm going to give you the final say here, because one last time, maybe you can to this audience seated here, and of course to all the others who are watching us online, what's the message? What should we be doing? What should we not be doing in light of all the latest evidence that we now have access to?
So there are several points that can be made in conclusion, Sharon. One is, at the center of this whole thing is a human being. Our main purpose of us being doctors or providing hospitals or anything else is only directed towards taking care of that person, right? So never forget that it's the patient who matters, nobody else. Then there is the insurance companies, there is us, there are technology companies that we are actually using to deliver care. So, yes, technology is coming hugely toward the rescue of the human being, and to us also. It's an exciting thing to be able to do things robotically, other things that have happened. But at the same time, we must contain cost, because ultimately that becomes the big barrier. So the safety net has to be created where the patient, what the patient can do is, one, actually pay attention to what are the facts that are available to a given person. We know what diabetes will do, we know what familiar heart disease will do, we know all the other things obesity will do, we know those things. But that mindset also has to change first. Second thing is that we have actually been able to create an ecosystem in which we can deliver healthcare at a very low cost, if you look at it with the input costs. Because we always get the same technology, the same consumables as anybody else does. Okay. So when you're doing this, you must keep in mind what is good for India is good for 4 billion people. Because the rest of them are even in more trouble than we are. And then you take the West as an example. You cannot get a CT scan in UK or in US If you wait for the government system, you will not get it for 6 weeks, 3 months, you're dead by that time.
Yeah.
So it's a question of, on one hand, the disease pattern, like you just saw yesterday. I got woken up rudely on a Sunday morning by a friend of mine who was running the marathon. 10 yards from the finishing line, he collapsed.
Oh my God.
So fortunately, he was in the stadium. They could resuscitate him. We moved him to a hospital, did an angiography, put a stent in, and he's alive and he's okay. But the point is that this is a guy who runs marathons, who was did the parikrama of Kailash even last year. So this is all deceptive. So to sum it up, I think everybody who has family history of diabetes or heart disease should get their first checkup by 25 years of age.
25?
Yes, if you have history. So like we say, know your genes. If you have no history, if otherwise things are all right in your family, you should at least by the age of 30 get your first checkup, because what that is like actually calibrating what's inside you. So you will know your pathway. Like I said, we can write that genome sequencing and we can write the health patri today. So, and it's not very expensive either.
Yeah.
So that's why I'm saying that if you know your roadmap, then it's up to you how you steer through it. But at least you'll know it. If you don't know it, and the other thing that's devastating is cancer. Cancer is the new heart. I mean, so now heart disease is not coming down, but cancer is galloping. Yeah. So we have now a double burden. So non-communicable diseases are going rampant, and we should do something. And the whole thing is to incessantly keep the information going and urging people to actually pay attention.
Well, I hope they're paying very close attention to what you have to say. But let me quickly ask you, what was it like when you first walked into the OT versus what it's like today? How have things really changed inside the heart of a hospital?
I mean, there's a human change, no question about that. We were actually, I'll tell you, we are the first batch of bypass surgeons, as we call ourselves, because there were only 3 centers in the US where it started. I was at one of them at New York University. We used to start an operation at 8 o'clock in the morning and finish at 10 o'clock at night, sitting on the floor of the operating room and seeing blood not clotting, because it took so long on the heart-lung machine. Today, an operation rarely lasts more than 3 hours. And the patient is awake 4 hours later, and they go home 3 to 5 days. So there is a complete change, because technology came to our rescue, experience came to our rescue, and our ability to do things in a much better, well-organized way has made a huge difference in our lives, and also our ability to give the best to the patient, no question.
Well, that's good to hear, but Dr.
Mortality was 20% when we started in 1969, 70. Today it is 0.2%.
Wow.
For a bypass surgery.
That deserves a big round of applause for all of the doctors who've been at it for the last many decades to try and deliver the outcomes that Dr. Trehan speaks of. But Dr. Indubhushan, as you sort of have experienced healthcare for yourself, but also designing healthcare for the country via many flagship missions, including, of course, the Ayushman Bharat mission, from the private sector's point of view and from the government's point of view, and we keep talking about this private-public partnership, many experiments have actually been very successful. Some have fallen by the wayside. Building on these successful ones, what do you think the government should focus on to get the private sector to work more closely with it to try and deliver the outcomes that we're hoping for?
Ayushman Bharat, PMJ, was the first government scheme where private sector was actually involved very closely. Before that, most of the government scheme, or I would say all government schemes, were being implemented by government itself. But I think as a next step, probably government should also try to get private sector for preventive and promotive healthcare, because that's a scheme, that's where private sector actually has not been very active. And right now, if you look at Ayushman Bharat, we are paying hospitals for treating disease, but not for wellness. And there could be incentive systems where we can co-opt the private sector for providing preventive health. And in other countries, for example, in Cambodia, we had this experience of giving the whole district on a capitation basis to a private sector system. So they had the incentive not only for treating people, but also ensuring that they don't come for treatment. So they were preventing diseases. So private sector can help in terms of screening, they can help in terms of long-term treatment, long-term management of non-communicable diseases. So I think next step should be like picking up on this from disease treatment to wellness. We need to get the private sector more closely involved in terms of ensuring wellness and providing incentive for that wellness.
Well, we have a couple of minutes more to go, so let me throw this open to the audience. Excellent. We have a gentleman right up here with a question, and we have more hands coming up. I'm going to try and get a microphone across to you. I'll probably come down with the microphone to make it easier and smoother. Can we get a mic to the audience, or let me just come down, sir, and get you to... Go ahead.
So this is a question for the panel. In my earlier capacity in the 15th Finance Commission when we were consulting you, no doubt this is the best public-private partnership. I mean, as Indu said, that it's phenomenal. I think what has happened is it's not the finances, because I've looked at the budget, I've seen that as a percentage of the budget, the state governments and the center can actually fund it even more. But when I try to push it as a universal health coverage, the response that I've been seeing coming from within the system is that we are not ready with our facilities to take on that load. So as a panel, do you agree? Because demand creates its own supply, and that's how it kicked off. You've got about 65% beds now in the private sector. If we universalize it, will the patient load become too overwhelming, or will it create the supply? That's the question.
Thank you so much, sir. Go ahead.
So, Arvind, I think if you make it universal, we'll need much more money. Right now, the biggest problem that I see in the health sector is that Government of India and government as a whole is putting in about 1 to 2% of between 1 and 1.5% of GDP into health sector, which is the lowest among all G20 countries. And WHO recommendation is also that it should be about 2.5%. Our own policy, National Health Policy of 2017 also says that by 2025, which is this year, we'll increase it to 2.5%. But we are still 1.4%. And nothing comes for free. If you want to expand services, you want to have more hospitals, you want to have more people in general, more healthcare providers, you have to have money. And so that is first thing that we need to do. If we want to really make it universal, government needs to put in more resources, and that is not negotiable. Yeah. And you're right that in terms of money, probably we can afford it, but we also have other priorities too. We have to cater for defense, we have to cater for infrastructure, education, and we have other schemes which are coming up like Ladli Behna and support for farmers. And actually, only a small part of that money, if that can be provided to health sector, probably we can still afford universal health coverage.
Thank you so much, Dr. Bhushan. Let me also welcome the Honorable Kiran Rijiju. Thank you, sir, for joining us here this evening. We truly appreciate your time. I'm going to take another 2 minutes before we come to you. We've got a gentleman waiting there with a question, sir. Go ahead very quickly.
I express my sincere regards to Indu Bhushan Sahab and my mentor, Dr. Naresh Trehan Sahab, who is not only my senior, but almost a role model for me. What I want to comment is, all my life I served the government, and in the later years I was on administration and joined National Health Authority also on several occasions. certain pitfalls which I want to point out. Now I'm practicing in a private hospital of the Ayushman Bharat are that one, we don't prioritize the patient who is getting beneficiary of Ayushman Bharat, and same is true for CGHS beneficiaries in the private hospitals. I'm not commenting anything negative about private hospitals. One. Secondly, some of the Dr. Trehan Saab mentioned, today we are having a bombardment of malignancy. And not only the rich, only the poor are also facing it. And the medicine supply through Ayushman for the costly anti-cancer chemotherapy is almost insignificant. Is almost insignificant, which is very sad part. And possibly those who are health administrators as of now must notice this part. When I was a student, sir will remember, we had one Professor R.N. Mishra who used to popularly say, in India, health is free, health treatment is free only for those who can afford it. Now Ayushman Bharat is changing that spectrum. Yes. One more small input. The ESIC of the Government of India is the largest health insurance scheme in the whole world, with more corpus than anybody can believe, and that has now 16 to 18 medical colleges and very large hospital. We must remember that, and we must take some lessons from that. Thank you very much.
Thank you very much, sir, for those inputs. Truly appreciate it. Thank you very much to the audience as well for joining us here. Thank you to Dr. Indu Bhushan, to Dr. Naresh Trehan and Uma for giving us the road ahead, the next chapter, the imperatives that we must focus on.
But let me just tell you one thing.
Yes.
As a policy, we should incentivize doctors and hospitals to actually keep people healthy rather than treat disease. So if that's the incentive, you will see a sea change, and I think that's important. Yes. To you, you said I'm almost your role model. Can you tell me about that almost part? Thank you so much. Thank you.
Thank you very much, sir. Thank you. Thank you.
Thank you, Shireen. Thank you to a stellar panel. Thank you so much. We'll request you to come together for a picture, please. Thank you so much once again. What a truly enriching and insightful conversation. A big thank you not just to our speakers who were so kind with their time and the kind of expertise that reflected, but also to the kind of questions that came from the audience. But ladies and gentlemen, this is now a moment of utmost privilege and honor for each one of us as I try and welcome a very special guest on stage. As I said, ladies and gentlemen, it is a moment of honor and privilege for each one of us today because we do have the presence of the Honorable Union Minister of Parliamentary Affairs and Minister of Minority Affairs, Government of India, Shri Kiren Rijiju, always been kind enough to take up the time and join us. A dynamic leader, a strong advocate of India's innovation-first vision, Shri Rijiju has always been instrumental in driving policies that empower young entrepreneurs and strengthen digital ecosystem. With a huge round of applause, ladies and gentlemen, join me in welcoming the Honorable Minister, Shri Kiren Rijiju, on stage to deliver his keynote address, please. Let's have a huge round of applause as we welcome him, please.
नमस्कार, गुड इवनिंग। थोड़ा सा मेरा प्रोग्राम में उल्टा हो गया, तो मैंने सोचा थोड़ा इंटरेक्शन का प्रोग्राम होगा, लेकिन अमीश ने अभी बताया कि मुझे कुछ की नोट एड्रेस देना है। वैसे तो अभी मेरे आने से पहले 3 बहुत ही डोमेन एक्सपर्ट्स का आप लोगों ने सुना होगा। मैं भी इन जैसे जो डोमेन एक्सपर्ट्स है, अलग अलग सेक्टर में जो सर्विस देते हैं, देश के लिए काम किया है, उन्हीं से हम इंस्पिरेशन लेते हैं। हम लोग जो राजनीति में है, सबका साथ मिलकर काम करना होता है और सबके लिए करना होता है, तो हम तो डोमेन एक्सपर्ट होते नहीं है कभी भी। First of all, I am grateful that I'm invited for this wonderful evening, and the entire Network 18 group are doing wonderful jobs, as we expect from the media house. At the same time, this kind of interaction is extremely important, not only for the audience, but for the media house also to assess themselves. At this point of time, I'm really not in a mood to deliver a speech, but what has come across my mind is how time has changed. Every moment, we see so many things happening. Yesterday, some people met me from very diverse background, and they told me that the mood of the nation or the mood of the younger generation is becoming more restless. I said, why it is so? They said, the sense of dissatisfaction, the feeling towards the system, the faith in the system is eroding. And at the same time, the surroundings of India, whatever we see, the political upheavals, those incidents which we have witnessed in last few years, first in Northern Africa, Middle East, and then in South Asia, except India. I said, I have a correction to make. With guarantee, I can say, whatever happened in the surroundings will never happen in India. I had this conviction since very long time, and I'm just sharing with you, taking this opportunity. There are some solid reasons which India will never face the turmoil which we witness in many countries. Some color revolutions had taken place in Eastern Europe, and then subsequently, as mentioned, in Northern Africa, Middle East, and in South Asia. The primary reason why it will not happen in India is, typically India is a subcontinent size. The governance on the ground is in the hands of the state government. It is not possible in a country like India where the central government will take care of everybody. Central government can plan, but the implementation will be at the level of the state government and subsequently at the local self-government levels. So the immediate responsibility of any failure will fall upon the state government and the local authorities. Secondly, India is so diverse that the entire India doesn't think alike. The youth of Northeast have a different kind of approach towards their lifestyle than what Gujaratis approach their life, what the South Indians, Central Indian, Jammu and Kashmir. You can see incidents in pockets, some of the pockets in India, but you cannot see pan-India. This is what I feel many people normally ignore this reality. Thirdly, the Constitution of India has been framed in such a way that military coup, the overtaking of system by some elements, it cannot happen. India's constitution is not only the largest constitution in the world, but it is the best constitution available in the world. For more than 2 years, the founding fathers of the constitution had intense deliberation on every subject matter, and finally the Constituent Assembly adopted the constitution. When I was the law minister, I had tried to evaluate the journey of the Indian constitution and its interpretation. Various constitutional amendments made by the Parliament of India and certain steps taken by the Supreme Court of India. So, if you go through the debates of the Constituent Assembly, whatever we have encountered now are already deliberated upon more than 75 years back. You can imagine the visions of the founding fathers led by Dr. B.R. Ambedkar. And as a Parliamentary Affairs Minister, we brought out a booklet last time. And I must share this with you. Including me, we were not aware of the essence of the Constitution of India, what are the symbolic things which the makers of the Constitution had adopted. So we published 2 booklets, one, the bigger one, another one, a glimpse of the making of the Constitution of its 75 years of journey. It's so beautiful. Some of the Supreme Court judges, including the former Chief Justice Dhananjay Chandrachudji, I just met him while he was going out, they all had appreciated the print which brought out in the form of a booklet. So, including we, the citizens of India, do not realize how beautiful our Constitution is. So every time I think about the members of the drafting committee and the members of the Constituent Assembly, how great they were. And then finally, no matter which party comes to power, they have to be responsive to the need of the people. Otherwise, 5 years, you have to face the people again. So when you have a recurring election after election, which are considered to be most difficult electoral process in the world, the anger which may have there with the people against the government will be taken care of if there is a new government. Of course, dissatisfaction will happen. So, there are at times some elements I see. I may sound a little harsh, but I have to say. There are some elements which try to create a kind of a situation where system should fail. There may be some temptation to question the authority of the Supreme Court or the judiciary, and at times people may question the Election Commission of India itself. बचपन में जब आप कुश्ती खेलते हो, आप जीत ही नहीं सकते हो, बार बार आप हारते रहते हो, तो बाद में आप किसी और को ब्लेम करते हैं कि मैं हारा नहीं हूं, मैं इनके वजह से हारा हूं. तो there are at times elements inside India and outside. Attempts are being made. And I had said this some maybe when I was a young member of parliament 20 years back. I said it. One day India will grow more powerful. India will be one of the leading nations. At times, we may have to face some kind of pushback from the other countries. When you are powerful, people will envy you. When you are weak, nobody will even think about you. So as India grows stronger, be prepared. You are going to face the pushback from more powerful countries. It is very natural. So slowly, you will realize that India will become targets of many competitive nations. We need not really worry about it. So at the end of the day, it is the government of the day which will have to set the course which the country will take. And not because I am a minister in Narendra Modi government, but as a parliamentarian for a long time and as a responsible citizen, I can say that our government, led by Prime Minister Narendra Modi, we have the ability to sense the pulse of the people. We understand the sentiments of the people. We know the requirement of the society, as well as we have a fair idea how India should be taken forward. So I want to assure that India definitely will not see a situation where people suffer a lot, people endure the pains and agony. We will never face it. There are many other reasons, but I have just pointed out some of the key points which they are in my mind. So Amish ji had told me that we'll have a bit of a question-answer round, but I told him that mere liye don't prepare any questions for me and just ask whatever you want to ask on the spot. I don't prepare my speech, never, even in the parliament also and elsewhere, except when I am making a country statement, when I'm having a bilateral meeting, or when I'm speaking as a minister representing India, then I have to speak the lines drawn by the foreign ministry and the concerned subject matter. The officials, they approve it, and we normally speak on that line, or we read. Other than that, I don't prepare my speech. But I was told to make a few remarks here, so I have come, and I thought, let us make a situation where everybody is comfortable that India will never fail. So I made that statement. Thank you very much.
Let's have a huge round of applause, ladies and gentlemen. It's not every day that we get to hear from the Honorable Minister, and always so honest and candid. Thank you so much, sir, once again. Ladies and gentlemen, as I said, this is a moment of privilege and honor for us, and it's been such a delight to hear from the Minister. But the reason that I asked the Honorable Minister to kindly stay on stage with us, because ladies and gentlemen, this really is that big moment for us. We're now going to felicitate the Optum HealthX Elevate Startups batch of 2025. But ladies and gentlemen, before I do that, at this point, I'd also like to take this opportunity and like to invite on stage Uma Ratnam Krishnan, Managing Director, Optum India, to kindly join us on stage. I'd also like to take this opportunity to invite Amish Devgan, the Managing Editor at News 18, to also kindly join us on stage, please. Lovely. Thank you so much. Lovely. Ladies and gentlemen, let's remember these are founders who are driving impact through technology, compassion, and a lot of determination. So before we start inviting them on stage, let's have a huge round of applause, because today's evening has been an evening of inspiration and innovation. Ladies and gentlemen, Now let's put our hands together for Bryota Technologies Private Limited for bringing AI-powered screening to make non-communicable disease detection affordable and accessible for all. Let's give it up for the team as we welcome them on stage, please. Moving on, ladies and gentlemen, do put your hands together for No Worry, No Tension Healthcare Private Limited for their AI-powered mental wellness app. Let's have a huge round of applause as we welcome the team on stage, please. Up next, ladies and gentlemen, is Linek Technologies Private Limited, making diagnostic imaging portable and affordable with India's first handheld X-ray innovation. Let's have a huge round of applause for the team, please. Let's keep the applause and the momentum going, ladies and gentlemen, as we welcome Vigorous Health Tech Private Limited for enabling smarter care via AI-powered healthcare management app. Let's have a huge round of applause as we welcome the team on stage, please. Congratulations once again. Up next, ladies and gentlemen, is Primary Health Tech Private Limited for developing MobiLab, a portable AI-powered diagnostic lab. Let's have a huge round of applause as we welcome the team on stage. Congratulations, gentlemen. Moving on, ladies and gentlemen, I would now like to invite Geo Innovation Private Limited for turning rural pharmacies into digital health hubs with their AI-enabled Geo Mitra e-clinics. Let's have a huge round of applause. Let's not hold back with the applause and momentum, ladies and gentlemen. As we said, a lot of inspiration around us. Now, ladies and gentlemen, join me in welcoming InfiHeal Health Tech Private Limited for developing Hilo, India's first multilingual AI therapist that is enabling 24/7 accessible and affordable support. Let's give it up for the team, please. Congratulations once again. Ladies and gentlemen, now let's put our hands together for our next startup, Pratibha Healthcon Private Limited for developing HealthCon, an intelligent, connected care ecosystem that really bridges the last mile gap from prevention to rehab. Let's keep the momentum going, ladies and gentlemen. Let's have one round of applause as we keep the momentum going, as we welcome all these startups on stage, please. And as I said, before I invite our next startup, we will need a little more enthusiasm and energy, ladies and gentlemen. Let's keep the momentum going as now we welcome Platanoid Technologies Private Limited for redefining telehealth at scale with its Myrex platform. Let's have a huge round of applause, please. Thank you so much. And ladies and gentlemen, our final starter for the HealthX Elevate batch of 2025. Please join us in welcoming WizFizz AI Private Limited for developing Visio, an AI-powered physiotherapy app for providing personalized and guided recovery through smart tracking. Let's have a huge round of applause, please, ladies and gentlemen. At this point, I'll in fact request the representatives of Visio to in fact stay back on stage, because at this point we'll also like to invite all the other startups to join us on stage so that we could in fact get a group picture with the Honorable Minister, please. So I'll request the representatives to kindly quickly join us on stage so that we can all have a moment to remember, a moment to cherish, a picture with the Honorable Minister. Thank you so much. Let's have a huge round of applause, ladies and gentlemen, as we thank the Honorable Minister for not just his kind words, but his time and expertise as well. Ladies and gentlemen, with that, we have come to an end of what was truly an inspiring evening. And one thing, ladies and gentlemen, is very, very clear, that India's healthcare story is no longer about the future, because it is unfolding right here, right now, as we speak. Through bold ideas, breakthrough innovations, and visionary collaborations, our startups are not just transforming healthcare today, but they're redefining access, impact, and scale. On behalf of Optum India and CNBC-TV18, I would once again like to thank all our lovely speakers, jury members, and you for being such a lovely audience. So thank you so much for taking out the time and joining us. This is your host, Ridhima Bhatnagar, signing off. I would now request all of you to kindly join us for dinner at Rani Bagh. Thank you so much and have a great night.